Testing, testing. Okay, good morning, everyone. So, move this mic. Welcome to our Thursday morning hearing of the Senate Standing Committee on Children and Families on the child care crisis in our great state of New York. I'm the chair of the committee, State Senator Jabari Brisport. I'm joined by our ranking minority member, Senator Rollison, and also committee member, Senator Ashby. This is a bipartisan hearing because child care is for everyone. I'd like to extend some thank yous, especially to my staff who did the lion's share of helping put this hearing together, especially who you cannot see on the camera, but my incredible legislative director, James Lastashevsky. I'd also like to thank the New York State Senate, especially Majority Leader Andrea Stewart-Cousins, our event coordinator, Ramel Wheeler, and media services, especially Eric Hoppel. I'd like to thank our witnesses for being here today, the child care providers, the parents, the policy experts and researchers, the administrators. We have people representing all parts of our great state, from Brooklyn to Buffalo, from the peaks of the Adirondacks to the depths of the Hudson Valleys, and we have incredible viewers watching. Thank you. It truly does take a village to raise a child, and building a universal child care system will take all of us. Unfortunately, we are not joined today by the Governor's Office of Children and Family Services, who declined our repeated attempts to give them time to share testimony today. Unfortunate because other witnesses have traveled for hours to be here, some from hundreds of miles away, and the Governor's Office of Children and Family Services is less than a 10-minute walk from this room. They said the timing right now was rather difficult, so I assume their absence can be blamed on understaffing and underfunding. We hope to address that in this year's budget. As everyone here knows today, the child care system is on the verge of collapse. These are problems that existed long before COVID, but were exacerbated by COVID. We have a fragmented system, a deeply underfunded one, poverty wages for a workforce that is mostly women of color, and we as a state do not value it as we should. We'll be hearing stories today and data about the state of the child care crisis in New York. And I'll extend some time to some of my committee members to share some words. Senator Rollison.
Thank you, Chair, and my colleague. And in this, I want to frame this discussion a little bit about myself. I'm a brand new state senator representing a new district, the 39th District, which is parts of Dutchess County, Orange County, and Putnam County. Prior to this honor of being a New York State Senator, I was mayor of the city of Poughkeepsie for 7 years. Prior to that, I was a member of the Dutchess County Legislature for 12 and a half years and a police officer for 26 years. I've been working with and helping people my entire adult life. I served in the legislature on the Children and Family Services Committee, heavily involved as mayor with the Poughkeepsie City School District. Everything always comes back to the child and to families. And as my colleague, Senator Brisport, said, the system is on the verge of collapse. It is in a crisis. We need to act, and the state of New York plays a critical role in so many parts of the public education system, childcare, daycare, preschool, that we have the ability to do things, and we have the ability to talk to others so they do it as well. And that's everything from funding to rules and regulations and how the system is working and how it's not working. And quite frankly, right now, we know we've got some big challenges. I was looking at some of the statistics about what we're going to hear from you today, and I appreciate, as the chair so rightly noted, you've traveled from many places far and wide throughout the state to come to tell us, what is happening out there, what we can do to be supportive. You're in the business. I am here as a state government representative to listen and to try to affect change with my colleagues on both sides of the aisle. It is a bipartisan issue. Children aren't political. Children are human beings that need care and need our support. But when you see, since 2014, we lost almost 3,000 licensed and registered child care providers in the state. That's a staggering number. So where are they going? Right? Where are our children having the opportunity to be? Because this, and I'll end with this because we really want to hear from you, don't necessarily want to hear from me, is that child care is important to the entire economic world. People being able to have a safe place for their children to be while they go to work or they go to school or they're caring for a loved one. When that system breaks down, the entire structure of our lives is thrown into chaos. And what concerns me, and I know my colleagues feel the same way, what do you do? And in many respects, you can't do anything if you don't have another support system. So again, thank you for the opportunity. Chair, thank you. I was really excited to hear that I was going to be on this committee because I've spent my entire life in this field, not the field of daycare or childcare, but listening to these challenges, trying to react and have some positive outcomes. And I think we can do it, Senator. I absolutely do. Thank you.
Thank you. Your opening comments? Or?
Sure.
No pressure.
Thank you, Chair Brisport. Thank you, Ranking Member Rollison. It's a privilege to be with everyone here today. I want to thank everyone for coming out this morning. I look forward to hearing the testimony, and I look forward to working with my colleagues to improving child care for everyone across New York State. Thank you.
Thank you so much. So a quick run of the rules for today. Each witness will get 3 minutes for their main presentation. We'll have 10 minutes of questioning per senator per panel. Reserve the right as chair to exercise discretion for some panels. And we will take breaks, which are not scheduled yet, but we will not have you all in the room for the entirety of the hearing. I'm going to call up our first panel. Panel A, we have Dee Dee Hill from the Schuyler Center and Pete Nabosny from the Children's Agenda. Welcome. Dee Dee, do you want to go first?
Okay.
Great.
Is this on? Okay.
Yeah.
Good morning.
Morning.
Thank you to Senator Brisport and to all the members of the Senate Committee on Children and Families for this opportunity to testify about New York's child care crisis. My name is Dee Dee Hill. I'm Policy Director at the Schuyler Center for Analysis and Advocacy. We are a 150-year-old nonprofit dedicated to advancing policies to improve the lives of low-income and disenfranchised New Yorkers with a real focus on children and families. I'm also here as a proud member of the Empire State Campaign for Child Care, which is New York's statewide campaign for universal child care. While I'm grateful for this opportunity to talk about New York's child care crisis, I am impatient because this crisis is not new. Many of us here today and many others long retired have been sounding the alarm for years. The way to end this and the child care crisis, persists because New York has failed to take the bold steps to make the significant, sustained investments needed to end this decades-long crisis once and for all. The way to end this crisis, the comprehensive and most equitable solution for New York is to implement universal, publicly funded, high-quality child care for all. Under this vision, child care would be available to all families, no exclusions, no income, activities, or immigration status tests, no administrative hurdles, no benefits cliffs, and it would be funded adequately to pay the workforce a thriving wage. On the road to universal, the Schuyler Center and the Empire State Campaign for Child Care are calling for New York to take significant essential steps this year to move the state closer to universal. And luckily, we are starting from a strong place. New York made really important, significant expansions to child care assistance last year. The state has also taken aim at administrative barriers that have for too long been intentionally erected to keep child care uptake low. And these are really important steps. But looking ahead, among the most important priorities we are calling upon New York to address this year, immediately and in a sustained way, we need to increase child care workforce compensation. Supporting and growing the workforce is the most urgent issue facing child care in New York State. Without it, we can't expand, we can't meet the growing need. New York must also continue breaking down access barriers, starting by extending child care assistance to all otherwise eligible children without regard to their immigration status. All New York children deserve access to safe, high-quality child care. I'll close with one note about the upcoming budget. Achieving universal access to high-quality, culturally responsive childcare that pays a thriving wage will take significant, sustained public investment. The governor is committed to investing a total of $7 billion to childcare over 4 years. This is an important start, but it is inadequate to achieve the goal of universal. With a state budget that exceeded $220 billion last year, and with one of the largest economies in the world, New York has the resources and the knowledge of what is needed to set the state on a short path to being the first and best truly universal child care system in the country. Thank you.
Thank you. Pete?
Thank you to Senator Brisport and the members of the Senate Committee on Children and Families for this hearing and the opportunity to provide testimony regarding the child care crisis in New York State. My name is Pete Nabozny. I'm the Director of Policy at the Children's Agenda in Rochester, New York. I'm also, with Dee Dee and many others in this room, someone who helps lead the Empire State Campaign for Child Care. At its best, child care is an essential support for families with young children. A trusted child care provider ensures that children get off to the best possible start to life, providing care to children while their parents work or pursue an education. High-quality child care helps families achieve economic security and provides a nurturing environment for children to explore, play, and learn. Unfortunately, for too many families in New York, child care is instead a constant challenge to manage. Many families simply cannot find a care setting that meets their needs, face long wait lists for a program near their home or work, and can't afford to pay the cost of child care. Meanwhile, their provider can't afford to charge less. Given the current funding structure of child care in New York State, child care provider wages are dependent on the prices they can charge families. Wages can only rise substantially if costs to families also rise. But if prices rise too high, families cannot afford care. Parents, often mothers, then too often leave the workforce. This funding structure results in child care educators making less than 97% of all other professions in New York State. The systematic undervaluing of the critical roles child care educators play, largely women of color, drives inequity and exacerbates gender and racial pay gaps. Low wages are also linked to high rates of turnover. This leads to instability for families and the children who depend on stable, nurturing relationships with their caregivers for healthy growth and development. In the summer, my organization released a report which found that New York State had lost more than 10,000 child care slots since the beginning of the pandemic. In anticipation of this hearing, I ran the same analysis with data from this January. We've now lost almost 20,000 slots. Care is increasingly scarce, particularly in low-income communities and rural parts of the state. Family child care, in particular, has borne the greatest losses over the past several years. Participation in our state's child care assistance program has also declined considerably over the last decade. In 2011-12, an average of more than 135,000 children were enrolled in our child care assistance program every month. In 2021-22, that number was down to under 65,000. The existing child care assistance application process without an online option or consistency across counties hurts families. Governor Hochul recently proposed several worthwhile initiatives to streamline access to child care assistance. These efforts include the development of an online screening and application process for families seeking assistance, as well as expedited enrollment for families receiving other benefits such as SNAP and Medicaid. Indeed, New York State has done a great deal to strengthen its child care system over the past several years. The state's expanded eligibility, raised reimbursement rates, and has administered several rounds of invaluable stabilization grants for providers still reeling from the effects of the COVID-19 pandemic. The initiatives recently announced by Governor Hochul will build upon these prior efforts. And yet, the fundamental nature of New York's child care system remains flawed. Too many families are excluded from the system thanks to administrative barriers or programmatic exclusions. Child care remains completely unaffordable for many families and is a tremendous economic burden to many others. There is insufficient public investment to ensure that every child in New York State has the opportunity to benefit from a high-quality child care experience. New York has the resources and opportunity to address this. Our state's leaders should commit to implementing universal child care within the next several years and should couple that commitment with significant investments in the child care workforce and eligibility expansions in this legislative session. Thank you.
Thank you, Mr. Nabozny. Thank you, Ms. Hill. I'd like to start with some questions for Ms. Hill. Just at the top, level setting about the past year's budget to clear up some misconceptions that I've seen here in Albany. and I want folks to accurately understand the scope of New York State's involvement in the child care system. So I'd like to start with some questions about the Last Look New York State 2022-2023 budget that the Schuyler Center put out this past year. That's a document that you put out every year to look back at the annual New York State budget, correct?
Yes, it is. I'm just pulling it out so I can refer to it.
Great. Thank you, Ms. Hill. What was the total amount that the child care community was asking for in last year's budget?
We were asking for $5 billion
For $5
in
billion.
new investment, yes.
Okay. And you say in the Last Look document, this budget is also a story of missed opportunity. Could you explain what you mean by missed opportunity?
Well, I think when we referred to missed opportunity, we were talking about more than childcare, but in the area of childcare, and I think Pete, already referenced pieces of this. Like, while there were significant new investments in childcare last year, and that's really important to underscore because it was there was an increase of about $145.8 million from the prior year's enacted budget. And in the prior year, there had also been bumps. So we're making progress in the right direction. However, the child care market is so broken that small investments in only one aspect of the market can actually lead to further destabilization. And so, for example, there has been significant investment in expanding access to more low-income families. This is so important, and it's a top priority of the Empire State Campaign for Childcare. However, if you don't couple that with significant sustained investment in the workforce, and if you don't raise the reimbursement rates for providers, then they can't expand to meet the need. And then the only alternative to drive more funding, more investment, is to charge parents more. Parents are paying more than, on average, $15,000 a year for one child, and many of us have more than one. And they can't pay more. We can't ask parents to pay more. They can't do it. So that is where the small investments, the significant new investments from last year are important, but they're not enough. And where we are right now is with a system that is perhaps even more destabilized.
Thank you so much. My office prepared a quick chart for viewers to clear up some of the differences. So just clarifying again, the demand was for $5 billion last year, and we were able to track about 1.3 in New York State's budget. Would you be able to explain, well, not just the difference? I believe many of us heard in various media and at the governor's State of the State the $7 billion dollar figure. Could you explain the difference between the $7 billion figure we've been hearing and the 1.3 that was in the budget last year?
So the governor has committed, my understanding, is $7 billion over 4 years. And that commitment was articulated, I believe, in 2021. So I think it started with the 2022-23 fiscal year. So what the state financial plan, it has incremental increases in the next 4 years, and if you add it all up, it does appear, and it's a little. Some of the math is a little slippery, but it does appear to be about $7 billion by the time we get to the. But it's adding each year one on top of the other.
Got you. And when you made the demand for $5 billion, was that per year or in total?
Our estimate was that what the sector needed and what families needed was $5 billion last year.
Yeah. And as far as you know, is there any legal commitment to spend $7 billion on childcare over any period of time?
My understanding is that the state fiscal plan is a commitment, by the governor and lawmakers. So we are hopeful and expect that the commitment will be fulfilled and added to.
Thank you. I have some questions for Mr. Nabozny. I wanted to look at some more demonstratives. Could you explain to us what the data shows in this chart?
Sure. So every year, the Office of Temporary and Disability Assistance reports. They get data from OCFS and the different systems that we have, but it reports to the legislature how many children were enrolled in the state's child care assistance program on an average monthly basis for the course of that year. So what this map shows is the difference between the enrollment in 2011-12, where there were about 135,000 children receiving support from the child care assistance program every month, to 2021-22. So over the course of a decade, that's the decline by county. You'll note that it is different in different places. Rates of decline vary, but every single social service district in New York State in 2021-22 has fewer children, in many cases, many fewer children receiving support from that program than it did a decade ago.
Thank you. And this one, slightly different title.
Sure. So this is comparing the state of, well, the number of child care providers, programs that were operating in January of 2020, right before the COVID-19 pandemic descended on us, to January 2023, actually data from 2 days ago. So this is quite updated. And you know, it does show in several places there are actually more programs operating, but by and large, across the entire state, we have lost a tremendous amount of child care capacity, a lot of child care providers. And when you dig into the data, into various communities, you'll see that low-income communities have really lost the most child care capacity. Rural areas have lost a lot of capacity. Conversely, areas with higher median income, zip codes where folks are a little more affluent, have seen some growth within even some of those areas where we've seen overall decline. But again, the picture statewide is that we're in a state of decline in terms of the availability of child care across the state.
And let's zoom in on New York City and the surrounding suburbs.
Sure. So same picture. You couldn't quite see it on the last slide because of the size of the city, but yes, again, Nassau County obviously doesn't show the same rate of decline as some other parts of downstate, but again, there's just fewer programs than there were several years ago across most areas of the state.
And family and group family childcare?
Yeah, I wanted to highlight this because this is where we see the greatest loss in childcare across the state. Some places like Wayne County, just to the east of where I live in Rochester, has lost over a third of its family and group family child care providers over the course of 3 years. And that's rate of change. So some open, some closed, but the overall number of providers and the capacity in these communities has really declined. And again, family child care is an incredibly important resource for families who prefer their child to be in a more intimate, smaller environment where they build a relationship with that caregiver over the course of a number of years. And it's also the type of care that's often more available in high poverty areas and particularly in rural parts of our state, which may not have the density to support a larger child care center.
Okay, I believe we have one that also just zooms in on New York City and
Yeah,
the
so-
suburbs again.
Yeah, again, same kind of picture as the last one, but this is again looking at family and group family child care. Nassau County has held up a little better than some other parts of the state for whatever reason. It'd be interesting to dig into that, but within the 5 boroughs and again in most of the other counties in suburban New York City, you see declines. Maybe not as sharp as some places upstate, but certainly a decline in the capacity of family and group family child care.
I believe we also have this table from your report as well, right?
Yes, yeah, that's in the report released last summer. And this is looking at by modality, so without digging into all the weeds, there's different types of programs that operate with different rules and everything. And this looks at the kind of losses and gains, because again, we do have constant churn, which is also a problem, right? We look at the availability of care, but you also have programs that are closing, opening, and that's disruptive to families. So in the rightmost column, you see the change, but you also have a lot of churn within the system. And so that's showing you that churn by program type. And again, you see the greatest churn among these family and group family childcare settings.
And just my final question, thank you, Mr. Nabazzi. Any overall patterns or takeaways you want us to have from this data?
I think what we're seeing there, everything's linked, right? You have lower participation in the child care assistance program, and you have higher losses among those programs that are more perhaps dependent on that program because they're operating in lower income communities where more families are qualifying for that assistance. I will note that the declines in the assistance program, the data the OTDA produces, it's updated through June of 2022, so we don't see the effect of some of the recent expansions in eligibility, which are starting to show some promise. Eligibility increased to 300% of the federal poverty level in August, and we have seen some uptick in terms of enrollment, particularly in rest of state, non-New York City. New York City, for a variety of reasons, has not quite seen that increase yet, which I'm sure some folks here testifying would like to dig into. But so we're hoping that some of these investments and sustained investments and continuing to grow eligibility for assistance will start to reverse some of these trends, and you'll see less red and more things in the black there.
Any other questions?
Yeah,
Mr. Ralston?
Thank you, Chair. And this is for both of you. So one of the things that I have experienced, and especially in my time as mayor, in dealing with funding streams through the state of New York. And actually, I testified in this very room earlier this year to the city's 2 committee about how we get aid to municipalities in a better way. It was essentially what this was about, and myself and Mayor Binghamton and the Mayor Troy. And specifically, one of the back and forth was, how easy is it to access state dollars that are appropriated? And we know it's not easy sometimes, especially, like my question really is outside of the commitment that the governor has made over 4 years, $7 billion, and would not really want to debate that number, but how difficult is it to access these dollars that are already out there for the taking, for child care and associated costs, and what can we do, what can we advocate to make that easier? Because like in a municipal government, larger municipal governments have staff that can do those types of jobs, access those dollars, report those dollars, where a smaller system, municipal system, or in a child care system, that might be more difficult. What has your experience been on that end of identifying, finding, knowing about, access to information?
Yeah, I think in all cases, complexity becomes kind of a tax on whatever entity is experiencing it, right? And so larger municipalities, larger counties may have more capacity to manage some of this stuff, although there are some real challenges that New York City is experiencing in terms of administering its child care assistance program, that in particular that families are experiencing kind of accessing care. So size isn't always a determinant factor, right? I think looking at the child care assistance program specifically, the barrier to accessing these funds is really experienced by families. It's the complexity of the application process. You could have, all of your materials in order, you think, and then you go and you finally get that application in, and you realize you had 1 pay stub instead of 2 or something like that. And so you've got to, your kids need care that next Monday, but you're not approved that day. There are some things that we could do to help families to ease some of those burdens. Some things like an online application, other things like assuming that if a family has 95% of their paperwork completed, that they're going to be good to go. Give them 30 days to grab that other form or whatever they may need, and let them start that new job on Monday. Let them start that care on Monday. Instead, that could disrupt that planned new job, and something falls through. So there's things like that. There's a lot of administrative neglect, I think, that's happened over the course of several decades. The fact that there's no online application for child care assistance in the year 2023 is frankly scandalous. We have it for a lot of other programs. It's much easier to set up a 529 plan for your kids than it is to, to access assistance for this. And so in most cases across New York State, counties actually have the dollars for childcare, and they're having a hard time getting them out because of a lot of burdens that families face. Some of it's eligibility, but a lot of it is just the kind of mechanics of how we've structured this program over time.
Yeah, and all that I would add is, it is important to note that the governor, in her State of the State, she specifically acknowledged that the child care assistance program, by design, has for years made it difficult for families to gain access to this assistance. And there are a lot of reasons for that, and this is not the only system that has been designed in that way. One of the reasons, for years, it has been starved of resources. And so we've actually put communities, counties, in a tough position where they're given inadequate funds to meet need, and so they have to navigate that. The good news is right now, due to pandemic funds and some of the other increases, the counties do, as Pete said, counties have sufficient resources right now to meet need. They will not have sufficient resources to meet growing need, but they have what they need right now. And so we do applaud the governor's proposals in her State of the State. They don't go far enough, but the acknowledgement that there are these barriers, and her commitment to breaking them down is really important, and we look forward to working with her and with all of you to make those commitments become reality. I would also note that with respect to the challenges that counties face in administering the program, some of these, if we simplify things for families, and if we make things, there are a lot of variations amongst counties. If we unify the requirements, then it also becomes easier for the counties to administer.
Because I think historically where we've seen system changes with funding, with staff, with access, with understanding, they all have to work together. And it's been my experience that when a family is in crisis, right? We can use that word, and we're talking about childcare in crisis, but the stress associated with having those challenges within your own family structure, and then you've got to try to figure a way to address that, and like you're talking about pay stubs and other things, and I understand there's got to be, checks and balances to the funders, but at the same time, people can walk away, right? And, you're under so much pressure to start that job on Monday. And there's other things that are the barriers to the job. Could be transportation and childcare and other things that you're going to find out once you get there what the job really entails. You can't put that pressure on people and expect them to navigate a complicated system. It doesn't matter how much money is there. And we cannot let people walk away from something we're trying to help them with, right? Yeah. And I have just seen that, in my public service career, that when you break that and you make it easier, people take more advantage of it, and they desperately need it. So I would love to know more about that, and that's something for a discussion, after this hearing about, what are the things that we can advocate for up here with our local providers. Dutchess County, Putnam County have the Child Care Council. I used to be on that council back in the early 2000s when I was first a legislator, and we're having some of the similar discussions today that we had in those meetings. So, but thank you for your discussion with us.
Just real quick, as a point to that, and the governor, I don't believe it, I'm not sure if it was in her State of the State or in the briefing book, I forget, but and OCFS has shared this recently, that they have data that shows that 50% of families that start the application process for child care assistance don't complete it. And that's telling you a lot, right? Because that's a family that's identified a need for care. Now, why they don't finish it, I think, is a question we need to dig into. Is it they can't find the provider that meets their family's needs? Is it the application process is too burdensome? Is it they can't get the appointment that they need to review it? Is it the job falls through while all these other things are held up? But regardless, that's a lot of families that are identifying a need for care who aren't ending up getting the support that they need to again, further their economic security, find a safe, nurturing environment for their child while they work or go to school or whatever the case may be. And, that's worth a lot more inquiry in figuring out what's going on there.
Yes, indeed.
Thank you both. Aside from increasing the rate of pay, which I think could be effective, in terms of growing the workforce, what other strategies do you see as being immediately effective and in the long term?
I mean, I can start, and luckily we have lots of colleagues here today who can really speak to that question. But I think a fundamental principle of the Empire State Campaign for Childcare and the childcare community is the first thing we need to do is we need to raise compensation. And as Pete testified, this workforce makes near poverty wages. We cannot ask them to do anything more before we raise wages. And they also need to see that the increase is sustained, like that it's not a one-time bonus, because we need to maintain those the current workforce, but we've already lost so many. We need to be building. We need to be drawing new folks into the workforce. And right now, as people are considering their career options, they see a career where there is no future. There's no way for them to get to even to economic security. So that needs to be number one. Then we need to talk about other investments and supports to help this workforce to create career ladders and ways in which the workforce can get the education that they seek and that they can sort of move up into the field and really make it a lifelong career, because we hear from so many members of this workforce that they leave not because they're, burned out or don't like it, or it's in fact to the contrary. Most of them have a deep passion for this work, but they simply can't afford to stay. For the good of their family, they need to leave this profession, which is just heartbreaking. I'm sure Pete has more to say.
Well, did he capture most of it, I think, but I'll just add that those investments in workforce and helping people identify this as a viable career, which takes a lot of different forms. Like we are focused on wages and increasing compensation and making the business more viable. Doing those things, making those investments has such a positive impact in the overall economy. If you get one more toddler room open, that's 10 children whose parents can participate in something else. They can go to work, they can go to school, they can further themselves and their family's future. And so there are enormous returns on investing in the child care workforce. And we want everyone to have a sustaining wage in many different fields. And obviously, we support efforts throughout, the caring economy to ensure that folks have that sustaining wage. Child care has a really big impact on the ability of all aspects of our economy to thrive. And so, those investments, particularly in workforce, and I speak to providers, to child care center directors out in Rochester where I live, and they have empty classrooms because they can't figure out how to draw the workers in, because they can't figure out how, they just know they can't charge their families more for care. And that's a real tension that exists at the heart of this child care crisis right now.
One more question. Earlier you had mentioned kind of some disparities between the rural and urban environment, and then the differences and the challenges that you've seen with targeted programs and resources going towards some and then creating further disparities. And you had mentioned the immigration status being a barrier. And I'm wondering, I have my suspicions, and I think we'll agree, that is this an issue that you see in more rural or urban areas, or rural or across the board? And if it were alleviated, would it have a more systemic effect?
In terms of immigration status in particular, or
just being a barrier to childcare, and have other states taken these measures?
Yeah, I mean, in terms of overall, the scarcity of care, if you look at it, and we've looked at it different times by like zip code, the availability of care, the trends are all kind of going in two different directions. Wealthier communities, wealthier zip codes are seeing kind of greater increase in the availability of care as more programs are able to operate there. Lower income communities are seeing the opposite. They're losing their capacity. And that tracks both urban and rural, right? So your higher poverty rural parts of our state have lost a lot of childcare capacity. If you looked at that, childcare assistance program participation rates, that's where you see some of our, lower income rural counties like Allegheny County's lost, I think it was like 80% of their enrollment over the course of a decade. In terms of immigration status, in particular, we have undocumented children living in New York City. We have undocumented children living in Orleans County, and their access to these programs, in access particularly to these early care and education programs, which can support them while their parents are doing and working, they're excluded right now. And it's not a huge number of families, but it is, it is something that those kids cannot benefit from while they're growing up. They're 2, 3 years old. They can't access these programs that their peers can.
And I think one other thing to add regarding immigration status, the reality is that almost all of our children in immigrant families in New York are currently eligible for child care assistance. However, there's real fear in the immigrant community often of accessing social services in general. And so we suspect, and getting hard data on this is difficult, but we have reason to believe that there are a lot of immigrant families who are deselecting, even though they're eligible. They're eligible right now for child care assistance. And so we think it's just really important for the state to make very clear that our child care assistance is available to all families. It's not a question that's asked. And as Pete said, the actual number of children who would truly be newly eligible is actually fairly small, but it would break down a really big barrier and we're a state that is welcoming and embraces all of our children, and we need to make that clear.
Thank you.
Thank you. So, Ms. Hill, Mr. Nabozny, I want to thank you for your witness testimony today, for sharing your expertise and all the work you do for children and families across New York State. Thank you so much.
Thank you.
Thank you for the opportunity.
For our next panel, I would like to call up Gregory Brender from the Daycare Council and Kathy Creighton from Cornell University ILR Buffalo CoLab.
Do you want to go first or second?
It's up to you. I'll go first.
You go first. Cool.
Ladies first.
All right.
All situated?
We're ready. Yes,
And
thank
Ms.
you.
Creighton, I heard you say you were going to go first? Or?
Yes, so thank you for having me today. My name is Kathy Creighton. I am the director of Cornell University's Buffalo office. In 2021, at the request of state assembly members Monica Wallace and Karen McMahon, and also Erie County, we were asked to conduct a study about the true cost of childcare. What does it cost to take care of a child, and how did that relate to the child care subsidy that parents were getting? And we found that there was a great divergence between those two numbers, that the subsidy rate didn't meet the actual cost of child care, not by a long shot. And with that information, then legislators went to Albany to ask for higher subsidy rates, and that the way that the system was being done to find out what the subsidy rate was really a system that depressed that number. So we were happy to see that those numbers increased in last year's budget, but we found some very alarming studies. Our office has been researching child care industry for 2 decades, and in a 2006 report, we found that the business sector's reliance upon high-quality child care was a necessary component to workplace recruitment, retention, productivity, stability, and that for every state dollar invested in child care, that New York State got back $1.52. That's a pretty good return on investment. However, 15 years later, our findings were very concerning. After rising for 10 years, the workforce, the numbers in the childcare workforce, rising for 10 years, even just prior to the pandemic, the childcare saw a great reduction in its workforce. And I'm going to repeat a lot of the numbers that the two prior panelists said. We've lost 20% of our childcare workforce, so it's gone. Poof, 20% gone. We didn't even have enough when I was trying to get childcare for my kids, and I can't believe it's that much worse now. And low wages is the reason for the exodus. We've held focus groups, and one childcare worker said, I know that I'm making less money by doing this job. I know exactly how much money I'd be making doing something else. And the low wages are really the reason for the exodus. When you can go down the street and get a job at a fast food restaurant and not have the headache of raising children, I shouldn't say it like that, because childcare workers are really passionate. In this room, there are many, many childcare workers that are passionate about the work that they do, and they're really heartbroken to have to leave the industry. They are among the lowest paid workers in New York State. They, in Erie County and in New York State, 80% of all childcare professionals earn below a living wage. That's 80% earn below a living wage. They are among the working poor. 31% of childcare workers rely on Medicaid. 19% are eligible for public assistance income. 18% receive SNAP benefits. And these low-wage workers are almost all women and disproportionately people of color. Due to the reductions in the childcare workforce, licensed care facilities in New York State only have enough capacity to serve 1 in 5 children in the overall population of infants to 13-year-olds. And this is where every parent in that household is working, 1 in 5 spots, and obviously that's not a universal number. As child care providers fail to retain and attract employees, they can't accept children into their programs. Thus, we have long wait lists of families desperately in need of quality child care, and parents who can't find child care can't go back to work. And given the foundational role that child care plays in our entire workforce system, allowing these dynamics to play out uninterrupted has multiplying and devastating effects throughout society and the economy. These problems illustrated by our research explain why the Treasury Secretary Janet Yellen described the U.S. childcare system as a textbook example of a broken market. While the new rates and increased eligibility in the 2022 budget were a step forward, they did not result in childcare workers earning close to a living wage, and they didn't fix the fundamental problems of the childcare system. Simply, our research shows that the market can't fix this problem because parents cannot afford to pay the cost of actually covering childcare. And we all are now painfully cognizant of the fact that when childcare suffers, the economy suffers as well. This week, the U.S. Department of Labor released a report saying that the childcare costs are out of reach for almost every parent in the U.S., and that when childcare prices are higher, mothers are less likely to be employed outside the home. Here in New York State, we cannot have a robust economy and avoid labor shortages when there are barriers to parents entering the workforce. Public funding and a system change are required. We have to collectively recreate childcare, not just find a temporary fix to an historic emergency. Cornell is standing ready to continue working with the child care providers, child care advocates, many of whom are in this room. On the train last night, I came with a number of child care providers that we worked with on this study. They're sure here behind me, and I was very happy to work with them. And we're mindful that these decisions must include all modalities. There's been discussion before, the 2 other speakers, about family daycare and group family daycare. Another important component of that kind of care is that they provide a flexibility for parents who have to work longer shifts or who have to go to work at 6, work the 6A to 6P hours, and so we cannot forget that modality. Thank you for having me. I've gone well over my time.
Thank you, Ms. Creighton.
Thank you, Chair Brisport and Senators Rallison and Ashby for the opportunity to testify. And Chair Brisport, also just want to thank you for always bringing in the voices of childcare providers, parents, through your tour, through your many meetings with childcare folks, and we really appreciate just how much you've been hearing and listening to and working with the community. My name's Gregory Brender, and I'm from the Daycare Council of New York. We are the membership organization of early childhood programs in New York City. We envision a future where every child has access to early childhood education, and all early childhood educators, staff, and directors are fairly compensated for that work. And we believe this is the year to move truly forward on that agenda. And there's a big role for both state and local government. We are part of the Empire State Campaign for Childcare, and so we fully support and I enthusiastically second all of the budget asks that Dee Dee and Pete talked about. And I'm going to concentrate my testimony on what our locality, New York City, can do to be part of it. New York City has been a leader in early childhood education going back decades. New York City developed the first contracted system of care that became a model for Head Start during World War II. We're one of the first places in New York State to offer every 4-year-old universal pre-kindergarten. And just last year, New York City launched Promise NYC, or just this year, New York City launched Promise NYC, which supported undocumented children. However, there's immediate steps that need to be taken to stop a crisis in New York City affecting the stability of its child care centers. New York City needs to ensure on-time payments for child care providers, achieve salary parity between the teachers, staff, and directors in community-based organizations and their counterparts in public schools, and establish equity in enrollment procedures. With regard to on-time payments, this is the most immediate crisis facing early childhood providers. A survey we did of 159 of our member organizations over the summer found that 29% of respondents had an unregistered contract. Only 13.2% of respondents were able to submit an invoice through the DOE's pre-KID system, and 41.5% of respondents had missed payroll or delayed vendor payments due to delayed payments from DOE. And this really means that the hardworking staff, people who are actually underpaid already, are in many cases waiting to receive their paychecks, and their landlords are missing their rent, they're skipping on groceries, they're walking instead of getting a Metro card, and really the hardworking essential workers are being punished by this issue. We also want to move forward on salary parity for early childhood educators. The staff, the teachers, directors in community-based organizations receive salaries that are much lower than their counterparts in public school. And so while folks develop expertise and really become great early childhood educators by doing it for years and years, for economic reasons, they often have to leave. And sometimes that means we're losing the most high-quality teachers and essentially operating as a training ground for public schools and for other places when we want people to stay in the field that they love. And finally, we want to see, and we hope that there'll be some more equity in the enrollment procedures, and the enrollment procedures will be made easier for families to access childcare. The community-based organizations that provide childcare have deep connections in their community. Families know them. Sometimes they're multi-service organizations. Sometimes they're longstanding community organizations whose board members are involved in people's churches, involved in block associations where people know them, and they don't have the ability to just have someone come up and say, I want to be enrolled in your pre-K program, I want to be enrolled in your childcare program, and enroll them there when they already know that community organization. So we would like the city to make it easier for families to work with their own, the neighborhood organizations they trust to access childcare. Thank you so much for the opportunity to testify. Looks like I went over time too, but appreciate it.
Okay, thank you, Mr. Brender. And Ms. Creighton, I know in your testimony you were saying you might be repeating some numbers. I think that's good and fine. People need to hear these numbers repeatedly to make sure that they sink in. I also want to thank you. Your reports on the true cost of childcare have been incredibly valuable, especially when we did our childcare tour last year when we were writing legislation around the issue. So really thank you for all you do. You said in your written testimony that child care subsidy provided to parents was not sufficient to pay the true cost of child care, not by a long shot. Could you remind us what is the amount of the child care subsidy you're talking about and how it's set and how far off the mark is it?
Well, so a market survey is done of child care providers and asks them, what do you charge for child care? And then when they say, I charge this, then that's the market rate. So that naturally keeps the the number down. So this year, that number was increased. We didn't have the market rate survey results to be able to see how that happened. What we found was that if you accepted a childcare subsidy, you were actually losing money in taking that child. And many childcare providers told us that they were actually losing money when they took children in who came with the subsidy. But they felt compelled to do it because those children needed some place to go. And they would find cuts in other places like food. It's really, or working longer and longer hours themselves without having other staff. So what the new numbers did was kind of bring it up to where the actual cost was, but that's still paying the poverty wages. So if you really needed to make a change, then that number would have to be increased enormously. And this is for people who are eligible for childcare subsidies. There's many people who are on that edge, who can't afford to pay for childcare, and who are not eligible for a subsidy, and they also may have to choose not to return to the workplace, but to stay home or make do or suffer.
Thank you. I'd like to uplift the phrase you mentioned, poverty wages. Could you just expand on how low are the wages in the childcare sector?
They are among the lowest 2% of people paid. So your question was, what could we do to get people into the industry? Senator Ashby, it really is wages, because there are plenty of people who want to do the work. There are a lot of people who are very interested in working in the early childhood education field. It's very popular in our community college, but when you see how much money you're going to make, it's really difficult. And when you have to take a job that you also have to apply for your own childcare subsidy or food stamps yourself, that's messed up.
Thank you. Mr. Brender, I wanted to talk more about the issues of non-payment from the DOE. To your knowledge, have all of the overdue payments been made?
No, they haven't. So after some uproar from the community and the city council, the school's chancellor made a series of commitments to work on it, but the issue has not been fully addressed. What was committed to was, one, reiterating that providers would be paid for FY22, the amount that was in the request for proposals, which is 75% of their contract value, and that there would be a rapid response team that would work on helping providers to submit invoices just for fiscal year 22, which ended for the city fiscal year, it's in July. We've continued to hear from providers who have not had their fiscal year 22 invoices paid. And I know some of them have heard from the rapid response team, but there are others who have not. And we continue to send names to Department of Education and work with them to try and uplift and move those centers where the payments have not been made. The other problem is that these commitments were only for fiscal year 2022, so some of these reforms would make sense happening in fiscal year 2023, which already started and we're 6 months into, but they haven't been implemented. So for example, for fiscal year 22, providers are now allowed to do multi-month invoicing where they can submit multiple back months for invoices. You're not allowed to do that for 2023, so if there are invoices that, for reasons of computer glitches within the DOE central system or your budget's not having approved, haven't been submitted, you're still not able to submit those past invoices. Similarly, the rapid response team is only working on FY22, so there's a lot of organizations who, while they have started receiving back payment for fiscal year 22, are not receiving the payment for the first 6 months of this fiscal year. We actually did a budget review with about 16 members just 2 Wednesdays ago, and of those 16 members, only 3 of them had been fully paid for their December 2022 invoices.
Thank you. Just my last question. As far as you know, have any providers needed to close their doors because of these problems?
Yes, Sheltering Arms, which is a multi-service provider both in they were in Bronx, Manhattan, and Queens, did have to make the painful decision to close their child care program, and they did so. They're closing several centers in all 3 boroughs. and actually their whole childcare portfolio, which was really tragic. This was a longstanding, high-quality program, and seeing it disappear certainly cost the community, and is what we don't need, exactly what we don't want to happen, is losing high-quality community institutions.
Thank you.
Thank you.
Any other questions?
For Ms. Creighton, and thank you for repeating those statistics too, because you need to continue to hear them, and they do sink in. But what is your experience in your region of the state when it comes to the 24-hour childcare system? In other words, not everybody works a 9 to 5 or a weekend job. What do you see? Is obviously it's not enough, but in some places it doesn't exist at all. So what is your experience with that?
Our study didn't particularly look at that issue, but when we did focus groups, what we heard from daycare provider or childcare providers was that group family daycare and family daycare really bear the brunt of that because especially during the pandemic with essential workers, and essential workers are required to stay at the workplace, and so they cannot come and get their children. And a center is more likely to close at a certain hour, but a group or a home setting, they end up taking children long after the hours that were set. So it's, a lot of it's like grandparents are quitting their jobs to stay, to watch their grandchildren, or there's a lot of make-do. But it's the family daycare and group family daycare that are really hustling in that market of off regular hours, not 9 to 5.
In Poughkeepsie, we're embarking on an exciting new building called the Youth Opportunity Union, which is the former site of the YMCA, which we were able to transfer to the county.
I'm a big fan of Poughkeepsie, by the way.
Thank you. Me too. And one of the things that is going to be a component, and this is a several-year build-out, is a nighttime daycare there as well. We're in a healthcare hub, and we know that many of our healthcare workers work the overnights. So they either can't take the job that's available, because there's lots of jobs available in healthcare, because they can't find a place to put that child or child's. So
There are groups that are working together in Boston. The building trades is working with the certain providers so they can have these off-hour coverage.
It's good to know.
Yeah.
And I don't know if, and I would say this to everybody here in the audience, I was going to say it in conclusion. Take a look at the Poughkeepsie Children's Cabinet. We are the only city outside of New York City that has a cabinet that brings the school district and city government with all of the community stakeholders to meet regularly to talk about these very issues. Mm-hmm. And it's been very successful because everybody's in the room, and which is always concerning because sometimes we're working in different places and we don't necessarily get to share the information. But thank you both.
I think we just heard from a little bit about what I was looking for, but do you know of any creative strategies that have been taken by childcare businesses, industries to retain and grow the workforce in light of the pay disparities that have been effective?
So definitely, I would echo that pay is the most important thing, but there are strategies to support and expand the workforce. One thing we're actually partnering with Bronx Community College is an apprenticeship program to help develop teachers' assistants in childcare programs. We're starting in South Bronx, since Bronx Community College is located there, where folks are actually working with a mentor in a childcare program and receive a CDA. Another piece, the CDA is the Child Development Associate. It's a credential needed for some roles in childcare centers. Another thing that's really important is supporting teachers who are on what are called study plans, and this is where you have your bachelor's, but you don't have your teacher certification, including the master's. So we have worked with the program, the Early Childhood Career Ladder, funded through the city and in partnership with DC 37 to help people who are on study plans receive their certification and become certified teachers.
How long
Then
is it-
you're making them I feel we have something similar at Erie Community College, and it's just a lifetime of poverty wages that you're apprenticing people into. So that is a concern, correct? I mean,
We would certainly say, yeah, I'd reiterate, the number one thing is increasing the wages. I think it has to happen on both ends. We need to develop a pipeline of folks into the programs, but we need to increase their wages and pay them fairly.
How long did that typically take, the STEP program that you were talking about?
The career ladder, because it's part-time, it's generally 2 to 3 years. But it's been longer in some cases, depending on, one of the challenges is asking people who work full-time and usually have families to also go to classes at night.
Is that something you think could be accelerated?
I think so. I think, increasing, and then I think that there are some options with colleges to offer programs in partnership with childcare groups, with childcare providers themselves, to make sure that schedules meet the needs of the workers, that, they could find ways with the schedules that childcare providers have to have the classes at the right time. I think there are ways to expand and strengthen these kind of models.
Thank you.
Thank you, Mr. Brender, Ms. Creighton, for your testimony, your expertise, and everything you do for the children and families of New York.
Thank you
Thank
so
you.
much.
Going to go to panel D and call up Heidi Jo Brandt from CSEA Voice. Is Heidi here? I see.
Good morning, Senators.
Morning.
Thank you for allowing us to testify this morning on behalf of the providers, children, and families of New York. My name is Heidi Brandt. First, I am a group family child care provider in Ulster County in Saugerties, so right across the river from Poughkeepsie. I've been licensed for 32 years, and I have taken care of hundreds of children and am proud to be in my second generation of families. I am also an advocate for children and families, as well as providers, the chapter rep for CSEA Voice for Ulster County, and the president of our statewide local, representing over 10,000 providers in all of the counties outside of New York City. Our providers provide care for both private pay families and families receiving child care assistance. Voice providers are primarily women of color providing care in the very low-income areas of our state. While Voice provides the child care, our brothers and sisters within CSEA of over 250,000 strong help run our state and local infrastructure every day. That being said, the lack of child care affects not only them, but every industry and profession in our state. Child care requires systemic change. To retain the providers we have and help our in-home providers to expand their programs. Our providers remain in economic peril. This is being exacerbated by inflation and now a triple-demic. The following areas where we could make investments and make the biggest impact would be to provide and pay providers the true cost of care. Right now, the child care subsidy only covers 63% of costs for each child. Shifting to a pay for enrollment versus allowing absences would help voice providers who are also small businesses remain intact with a solid business plan to continue to serve the children and families in their communities. As my fellow advocates have already stated, in-home voice providers are among the state's only modalities of care that serve untraditional programs, including weekends, overnights, and holidays. Voice providers are also the only options in most rural communities. Our providers have struggles across our counties in the rest of state. Locally, with our districts, we struggle with ununiformity with county plans. Counties are requiring not only contracts or agreements, they're requiring special insurances, and there is a very large disparity between the number of absences they allow. In that regard, we cannot offer our children and families of New York State who are eligible for childcare any more openings because there aren't any. So we have to build our foundation in the infrastructure in our child care industry, maintain it and build upon it so that we can offer these quality in-home child care slots to the children and families of our next generation who deserve a loving, safe space. Thank you.
Thank you, Ms. Brandt, and thank you for your testimony. You know, a lot of the funding allocated in the previous 2 years has been framed as stabilization grants or emergency funding, framed as recovery from COVID, from this triple-demic. But these issues in the childcare sector, the insufficient staffing wages, the insufficient staffing levels, the low wages, the number of providers that are closing, would you say that these are only temporary issues caused by COVID-19 and nothing else?
Absolutely not. For the past 15 years, providers had not seen an increase. In fact, we saw a decrease in the market rate. We were at the 80th percentile, and we were dropped down to the 75th percentile to hold our rates stagnant. And that lasted for 12 years. We saw no increase until just recently. The significant increases that were made are certainly helpful, especially for providers who serve primarily subsidized families. However, that is also hurting those providers because those are the providers who are on subsidies themselves. So now they're at a cliff. Now they're making too much money to be eligible for these benefits. However, if they're paying for them on their own, they're right back to that financial economic peril that they were in previously. And if you have a multi-group, so you're serving both subsidized children and private pay, you cannot charge your local district more than what your private families pay. And with the major increase that just happened, private families cannot afford that sometimes $100 or more a week payment increase.
Thank you. And when you think of a lot of these problems that you're mentioning, again, the insufficient ability to staff, the payments, the closures of childcare providers, thinking back to April of last year, the last New York State's budget, would you say some of these problems have improved, stayed the same, worsened?
They've created a new set of problems. So they've created the problems that I've just mentioned with our providers servicing low-income families, and were low-income themselves. Another new set of problems is inflation and the New York State minimum wage increases. So our providers are also small business owners. So we have employees. So whenever we have to increase their pay, our pay is less. So in my case, I make less than my lead assistant after 32 years. So there is family child care providers have not had the respect that they've deserved as early childhood educators since the inception of family child care. We deserve to be paid in parity with like professionals, and we deserve the respect that we have earned over the years as we are caring for the most vulnerable population of our state and our nation. We are caring for our infants and our toddlers. And why are they being left out of the equation? That their care is not education.
So you mentioned that you take home less pay than one or some of your staff, and we also know that the wages for staff are too low as it is. How do you live earning less than a living wage?
I am lucky enough to have my husband who makes a very good wage, so that's how I remain open, and I remain open and dedicated to the profession because this is what I believe in. This is what I wake up to do every morning, and why I am so passionate about family child care. So we're not just caring for these children. We are the support system for the parents. We are their friend, their mentor, their social worker. We are the children's nurse during the day, their comforter during the day. We wear so many hats that it becomes very stressful. There is a lot of burnout happening in our field, and our parents and families are feeling it. Our staff is feeling it, and that is one of the main reasons of the staff retention being so tough. We are regulated and over-regulated on top of the stressors of the pandemics, on top of the needs of the parents, and on top of our own expectations on how we envision our programs to be run.
Thank you. And you mentioned inflation earlier and how it affects take-home pay. Does CSEA Voice have a contract with New York State? And if so, would it be helpful to index the amount of reimbursement to the rate of inflation?
So we do have a contract with New York State. However, the contract is not necessarily in regards to reimbursement rates for subsidies. It's, so we offer professional development, training. We offer a CDA program to raise the level of professionalism to our providers. We offer mental health trainings, self-care trainings, and actually all the trainings across all 10 all 10 requirements for the OCFS licensing procedure.
Thank you.
Yes.
I want to thank you, Ms. Brandt. It was very evident why you do what you do. And I think, people who are in this important aspect of a child's life and the families that you support do it, obviously not for the money, right? I mean, I'm not even trying to be, facetious. Say I know that. I mean, the passion and the dedication to children and to their families to give them the opportunities that you had probably, right? And obviously the pay situation, this is reset time. We've come through a pandemic. We've seen so many things change in the past 2 to 3 years that we might not have seen Unfortunately, it took something like that to really to enlighten all of us. And education and wellness and all these things that's what you have to have day one. That's really mental health component in it. We've asked so many people in so many different careers to do different things that they never did before, because they're on the front lines. They're dealing with people, and they're dealing with all these different challenges. But I want to end with this question, because I want to understand CSEA voice, because I don't. The linkage between the two, and with CSEA, who obviously has 200,000 employees plus here in the state. Could you just expand upon that, just to bring me up to speed?
Sure. Almost 20 years ago, a group of providers decided that our little community-based groups were not getting any action done for us. We had no way to advocate with OCFS, with local government, to make any change or have our voices being heard. That group of providers went to CSEA and asked if we could design a union for providers, which was unheard of then, as we're all small businesses, and how can we do this? And Danny Donahue brought us in with open arms. It took us 7 years. We were first vetoed out, and then Governor Pataki signed into law our bargaining rights. So that's how that came into play, and we have worked side by side with our brothers and sisters in CSEA across the state since that time.
Thank you.
Thank you for being here, and thank you for your continued commitment. You had mentioned overregulation in some of your remarks, and I'm wondering if you could expand on that and perhaps provide some suggestions into ways that, if there weren't maybe targeted areas where there is burdensome regulation, if it were to be relieved, how it could help right now.
Sure. There are 3 key areas where regulation could help. Previously, in-home family providers were allowed to have multi-sites. That meant that one child care provider could own many sites and have an on-site provider in charge of that site. So the license, so there would be, and they're still in existence today, they were grandfathered in, so we still have them, yet that regulation was taken out, and now we are prohibited from having multi-sites. Another way is to, with waivers, because I understand that not every provider across the state is as high quality as we would want them to be. So there are waivers out there. OCFS asked us during the pandemic to apply for waivers to take on extra children because centers had to lower their numbers or close. Schools were closed, and where were these school-age children going to go? We gladly submitted waivers and took on as many extra children as we thought we could. We were granted the waivers, and then we were doing remote learning on top of our regular care for the children that we already had enrolled. So now we were teachers on top of caregivers. Once the pandemic was over, those waivers went away. So if you already have seasoned providers out there in good standing, why wouldn't those waivers come back to the table to help with these child care deserts? And another third way that we have been continually fighting for is to create regulation that equals daycare centers in reference to the infant age. Right now, an infant is considered in family child care 2 years old. 2 years old is an infant. In center-based care, it's 18 months. If they were to lower that age in family child care, that would open up infant slots across our state.
The waiver component is interesting. Have you discussed this with anybody at the state?
Yes.
And what have the results of those conversations been?
The feedback has not been positive.
Keep at it.
Mr. Chairman, could I have a follow-up?
Yes.
With Ms. Brandt? When you were, 2 points to this, and I think my colleague Senator Ashby was also talking about it. The multifamily that you could do, have multiple family sites, and then you can't have that anymore. Why is that?
That is a question better answered by OCFS.
Okay. And just an observation, it goes to all the conversation that we had so far and what we'll have today, is that there were many best practices put in place very quickly by professionals like yourself during the pandemic. And people on the front lines worked through it, and you provided a service and then some. And now it seems, just what I'm hearing, especially from your testimony, is that we're going back to the old way. The new way was great when we needed it, unless these were outcomes or things that weren't working. It doesn't sound like they weren't working. They were working just well. And now we're just going to go back.
Correct.
Doesn't make any sense to me. And what I would say, and it's unfortunate, I know the chair spoke to this earlier, when you can't get the answers, that's disrespectful somewhat to me. Even if they're not great answers or not the answers you want to hear, you should be getting that from people who are ultimately, you have the regulatory authority over you. So that's maybe something that we could be helpful with, Chair. Right? Maybe they won't answer us, but we can ask too, right?
Yes. Ms. Brandt, I just want to thank you again for your testimony and you're sharing your personal experience and your vulnerability with us, but also your expertise and everything you're doing for the children and families across New York State. Thank you so much.
Thank you.
Okay, for our next panel, I'm going to call up representatives from New York City agencies, from the Administration for Children's Services, ACS, and also the Department of Education, DOE. Names, but from ACS we have Elizabeth Wolkamir, and from the DOE we have Kara Ahmed. Thank you both for being here.
Thank you.
Any preference on who would like to start first?
Yep, I'll go ahead.
Okay.
Great, thank you for having us. Good morning.
Thank you.
My name's Elizabeth Wolkamir. I use she, her pronouns, and I'm the Deputy Commissioner for the Division of Child and Family Wellbeing at New York City's Administration for Children's Services. Senator Brisport, congratulations on your reappointment as chair of the committee, and thank you to you and the committee for holding today's important hearing on childcare. The division I lead focuses on investing in families and communities, including through the provision of vouchers that help parents cover the cost of childcare. As the local social service district, ACS administers the federal and state child care block grant, which supports the Department of Education's contracted child care system, as well as child care vouchers issued by both ACS and the Human Resources Administration. Our work has been strengthened by changes the state made last year, such as increasing child care resources for localities, increasing income eligibility for low-income child care assistance, providing stabilization grants to providers, and most recently, signing legislation enabling counties to authorize child care eligibility for up to 24 months. Last June, Mayor Adams released a blueprint for child care and early education in New York City, which lays out a vision to achieve equitable, high-quality, affordable access to child care. Over the past year, ACS has accomplished many of the goals laid out by this blueprint, and I'll speak about a few now. We eliminated the child care voucher waitlist, issuing vouchers to all those interested and eligible, which also allowed us to open applications for vouchers to low-income families across the entire city, including in 17 high-priority neighborhoods. In just the past 10 months, we have nearly doubled the number of children from low-income families enrolled in childcare using an ACS-issued voucher. ACS also received $10 million in city funds to launch a new program, Promise NYC, to provide childcare assistance to children whose immigration status precludes them from participating in subsidized childcare programs funded by federal and state funds, namely undocumented children. There is more work to be done to build on this progress, and we were pleased by the governor's proposals in the state of the state, such as increasing income eligibility and allowing income determinations from programs like SNAP and Medicaid to be used to determine income eligibility for childcare assistance as well. However, we are disappointed that the legislation to delink hours of childcare assistance from the hours a caregiver works or goes to school was enacted in a manner that limits its applicability to childcare funded by localities. We continue to believe this policy would benefit parents, children, and providers, and we're eager to work with you to pass another bill that will finally provide the flexibility and stability families and childcare programs so badly need. In addition, we continue to support legislation that would eliminate the state requirement that a family make at least the minimum wage to be eligible for childcare assistance. The progress we've made are steps toward the vision we share with this committee to make childcare universal. We look forward to working together to continue to bring us closer to that goal. Thank you.
Ms. Ahmed?
Hi, good morning. Thank you, Chairman Brisport and members of the New York State Senate's Committee on Children and Families for the opportunity to testify this morning. I'd also like to thank my colleague, Deputy Commissioner Elizabeth Wilkemer from New York City's Administration of Children's Services for joining me today. My name is Dr. Kara Ahmed, and I am the Deputy Chancellor for Early Childhood Education for New York City Public Schools. As a former early childhood educator and principal, this work is personal to me. And it is personal to our Chancellor, Chancellor David Banks, who rightly proclaims that bold futures begin with bright starts. We are both proud of what has been accomplished in a very short amount of time, and we're confident in the progress that we'll continue to make. We are committed to offering a range of high-quality birth-to-five programs in every neighborhood based on the needs and the preferences of our families and their communities. We are also proud to have the capacity to serve over 140,000 children, which includes more than 10,000 infants and toddlers. We are providing 3K and pre-K in every district in the city in a variety of settings, including both district elementary schools, standalone pre-K centers, family child care programs, charter schools, and community-based organizations. I want to publicly thank all of our early childhood educators and program and school leaders who have devoted themselves and their careers to serving our children and their families. There is no possible way that we could have done this work without them. New York City Public Schools has a budget of approximately $2.2 billion for our early childhood education portfolio, which includes all of our programming serving children from birth to 5 years old. Approximately $450 million, or 21% of our budget, comprises one-time federal stimulus funds, which will expire soon. Approximately 25% of our overall budget includes state funding, primarily for our programming for 4-year-olds, and about 6% of our budget is funding from the Child Care Block Development Grant that supports our 3K and pre-K extended day and extended year seats, as well as our infant toddler seats across our portfolio. So we're very grateful for this state funding and for the continued support of our state partners. High-quality early childhood education that meets the needs of our young children is an essential part of our school system, and it's a priority of this administration. We want to continue to build on what is working while we address any gaps that adversely impact our children and their families. We are proud that Chancellor David Banks announced last year our commitment to help stabilize the CBO sector. They are invaluable partners in this work, and it is a workforce comprised primarily of women and women of color. CBO partners are the cornerstone of their communities, and it is important to work in partnership to ensure we're serving their neighborhoods as well. So I'd like to give a personal thank you to Chairman Brisport, who has worked closely with our team over the last several months to help address issues facing local providers in his community and ensure that his constituents still have access to those very important services. So thank you very much.
Thank you.
Since the Chancellor's announcement of our added support to stabilize the sector just a few months ago, I am proud to report that we've been able to assist our CBO partners in submitting back invoices from the previous fiscal year, resulting in approximately over, I will say, this week, $100 million in payments in just 2.5 months' time, and totaling more than $1 billion over the course of fiscal year 2022. We've also delivered on the city's administration to stand up a stabilization fund grants and have already identified dozens of eligible vendors who will be receiving in total millions of dollars in stabilization payments, numbers that will keep growing in the coming weeks. Our administration believes every child from every zip code must have access to a high-quality early childhood experience, and that includes our children with disabilities. Last month, we announced that our early childhood education system would include a strategic and intentional focus on serving young children living with disabilities and their families. New York City Public Schools is addressing these historic inequities by not only expanding the number of seats available, but also ensuring that existing seats can remain in place, completely stabilized, giving our families and providers the stability that they deserve. We are also ensuring pay parity to those providers and access to the same length of the school day that a child would receive in any of our early childhood classrooms. Families of students with disabilities need reliable childcare, and we are committed to making that a reality in New York City. While I support the Chancellor specifically with regards to early childhood education, New York City Public Schools also provides our families with opportunities for childcare beyond their school day. In particular, the state provides resources supporting our schools and families that include the 21st Century Community Learning Center Grant, the Extended School Day Violence Prevention Grant, Empire Grants, and the city also provides extended day school programming through Compass, SONYC, and Beacon funding streams in partnership with the Department of Youth and Community Development. These programs help provide childcare, vital childcare, for our school-age children and support working parents. While there has been incredible progress made, let me be clear, this is certainly just the beginning. Our mission isn't close to accomplished, and we have a lot of work ahead of us. And we aim to continue on this path in service to children and families across New York City. Thank you all for your time, and I look forward to answering any questions that you may have.
Thank you so much, Ms. Welcomere, Ms. Ahmed. You know, we've been hearing a lot this morning, and we'll be hearing a lot more about the need for deeper public investment into the child care sector. So I want to bring up a letter that was concerning to me. It's a September 12th letter from the Mayor's Office of Management and Budget with Budget Director Jacques Jiha writing that agencies are expected to reduce their city-funded expenses by 3% in fiscal year 2023 and 4.75% in fiscal years 2024, as well as the out years. If PEG targets are not met, the Office of Management and Budget will identify savings opportunities. Given the magnitude of the threat to our financial stability, every agency must participate. And zoning on that claim that every agency must participate, does this apply to ACS and DOE?
I can speak only to the child care piece of the work, to which I'll say that we, given the work ahead and given the fortunate position we're in to expand access, we have actually been able to bring on resources, additional resources, to be able to make sure that we are processing applications and enrollments on an ongoing basis.
Yeah, I would certainly agree with the Deputy Commissioner. I can only speak to the Division of Early Childhood, but as a whole, we are maximizing our resources. You know, we've been able to take a really good look at the resources that do exist within our own division to understand where the resources are needed and where they're needed most to support children and their families.
So as of now, neither of you have heard of potential cuts specifically to early childhood education or child care in coming years?
That's correct, as of right now, yes.
Okay. And looking at the blueprint with both of your agencies as the lead agency for several issues, do you feel confident you'll be able to meet those goals even with anticipated cuts to the agencies at large?
The blueprint that the city, in partnership with all of the different city agencies, has put out is ambitious and it's audacious, and it's what our families and our children deserve across the city. And so there are items there that the Department of Education in particular, the Division of Early Childhood Education, has committed to working on, which is really ensuring that we have seats for children in the right places in the right locations to meet the needs and the preferences of families across New York City, as well as developing our workforce, which we've heard from others and some of our colleagues this morning that have testified around the need and the significance of consistently providing pathways and career ladders to support our childcare workforce across New York City.
Got you. And just one more time to clarify, do you expect any cuts to early childhood education based on larger cuts to ACS and DOE?
I can only speak to what we know today, which is that there are not currently cuts that we are aware of, or I'll speak for myself that I'm aware of.
Same.
Okay. I want to talk about the Promise NYC program. I was very pleased to see it. I actually carried the bill to bring childcare to undocumented children statewide. As of now, do you know how many youth are participating in the program?
So the program just launched this month, and the 4 community-based organizations that we're working through have started their work on a rolling basis. We expect to be able to serve at least 600 children between now and the end of the city fiscal year at the end of June. I don't know current numbers of who's participating since the program is just launching. I will say that we definitely have in excess of 130 children already determined eligible.
Great. And I want to circle back to the delinking bill that you mentioned. How exactly are you constrained by the bill as it is now?
The bill as it was signed and put into effect now is only impacting, per OCFS guidance and interpretation, is only impacting city-funded programs. The ACS voucher system, as well as the Human Resource Administration voucher system, is heavily funded with federal funds, which means that the bill as it's passed today does not allow us to delink the hours that a parent is involved in a qualifying activity and the hours that the child can receive subsidized care. And so effectively doesn't impact the vast majority of the children receiving vouchers in our system.
Thank you. I also want to address the work you've been doing to eliminate wait lists. I have a letter here from your, do we have any extra? Could you drop them off?
Thank you.
So this is a letter from Elizabeth Gilroy from the New York City ACS. It's addressed to Janice Molnar from New York State OCFS. And about halfway down the page, it says, ACS requests to amend our response to whether there will be a waiting list where there are not sufficient funds to open all eligible cases from a yes to a no. And I just want to clarify, were you copied on this message or have you seen it before?
I have seen this before. I will say this message is from a time when I was out on family medical leave, which is why there's a different signatory.
Gotcha. Do you know if this request was granted by OCFS?
Because we are currently in a situation where we have sufficient funds to serve and process applications from across the city, we have not reopened a conversation with OCFS now about what a wait list would look like because we don't have one and we're not in need of one.
And I just want to make sure I'm reading this correctly. Is this letter saying that ACS does not want to keep waiting lists anymore going forward?
I'd have to go back to the full context of this letter to be sure that I can speak clearly to what the intention here was and where we were at the moment in time that we were making this request. So I'm happy to come back to you on that.
Yeah, please do.
Yeah.
'Cause, most of it, when you hear the phrase eliminate wait list, people, the first thing that comes to mind is that you will expand capacity to ensure that no one else is waiting for their child to get into care. But this letter appears to be that the agency wanted to hide the number of people who were trying to get childcare by just eliminating any reporting of a wait list. So if you could get me more information.
Sure. I will say, I believe the context, if I'm speaking to the time frame correctly, is that this was at a moment in time when we had begun moving through the wait list and we're on a path to open applications citywide. And so what we didn't want to do is to continue to create sort of a waiting back door. We wanted to be able to get very quickly to the point where we could open applications across the entire city, which is what we did. And I believe that that's what this letter is referencing. So not a matter of hiding numbers. I think we were always transparent about where we were on numbers, but didn't want to continue to add people to a wait list and instead wanted to tell them transparently when our doors were open so that they could in real time apply and not have to go through 2 processes, filling out a form to put themselves on a wait list and then actually having to come in and apply for us. So what we did was to keep a list of those interested in childcare and then sent mass communication to everyone who had told us they were interested at the moment that we opened applications citywide.
Thank you.
Sure.
Ms. Ahmed, I want to talk about issues of non-payment or delayed payment. We received written testimony from DC 37, which noted that there have been bureaucratic delays at the New York City Department of Education, that this summer they were made aware of dozens of centers represented by DC 37 that were owed payments, which caused workers to go without pay for anywhere between 2 weeks and 8 weeks, causing tremendous hardship, including threats of eviction, homelessness, late charges, medical emergencies, and more. Do you have any updates regarding the non-payment issue?
Absolutely, and thank you for the question, Senator Brisport. As I shared in my testimony, there's been incredible strides in the work that's been done since the Chancellor made an announcement to our commitment in early November of ensuring that we can support the sector with submitting back invoices that date back to the onset of the fiscal year of 2022, which goes back to fall of 2021. And so just in 2.5 months, there's been over 3,000 of those invoices submitted, which are required to release payment. And so they've either been paid or resolved with over $100 million that's actually been released. Over the course of FY22 as a whole, over $1 billion has been paid out to providers. And so it's unacceptable if there are any invoices that are submitted and then payment is not made. And so as I've said to all of our membership organization partners, DC 37, Daycare Council, and others, please always reach out to me directly. We have our IGA team here. Anyone can reach out directly so that we can look into those inquiries. But there is tremendous progress that's been made. We inherited a system that didn't have a system in place to support the infrastructure needed to support the rapid expansion of this work. And so we are working really hard to create those systems now and to establish those. And we're going to move forward with ensuring a very healthy and sound and responsible fiscal system.
Thank you. Could you give us more context for the numbers you mentioned of contracts and dollar amounts? Like what percentage of late payments would you say have been addressed now?
Well, we are over 90% of the invoices that were owed for fiscal year 22 have now been submitted. So that's a huge stride. And given that the fiscal year ended at June 30th, and the new fiscal year began on July 1st.
Thank you. And let's take another question or two. In the written testimony from DC 37, they talked about the issue of centralization versus decentralization at the Department of Education. And they argue, I'm paraphrasing, but they argue that the services of payment can and should be handled centrally, and that the decentralization has been causing a problem. Would you share that assessment that decentralization at the DOE has been causing problems with non-payment?
I'm not sure what that means in terms of decentralization. Payment is being processed centrally at the Department of Education for contracted programs that are contracted with the Department of Education.
Okay. I do have another question about the city's Universal UPK program and the 3K program. Around how many students would you say are enrolled in both UPK and 3K?
Sure. I can tell you that currently, let's see, I can pull those numbers for you if you just give me 1 second. So we have about 85% of our utilization rate for a pre-K currently right now, and I would say approximately 61% of our pre-K is filled at this point.
Thank you. And we've also received written testimony from the New York City Independent Budget Office saying also, unlike pre-K where the city secured additional state funding for universal access, the city's 3K expansion efforts rely on federal COVID relief aid that will expire by the 2024-2025 school year. So I know earlier we talked about proposals to cut funding from city agencies, but moving forward, do you know if there's any plan to seek funding from the state or federal government?
As I had shared in my testimony, you're absolutely right. We are facing a $450 million fiscal cliff as that is given as one-time federal stimulus funds used to support the majority of our 3K programming. And so we were able to make incredible strides in New York City of expanding 3K and pre-K as relying on our city and our state and our federal partners. And so we will rely on our city, state, and federal partners on the path forward to make sure that we can replace those funds and fully sustain 3K programming.
Thank you.
Thank you for coming up to speak with us today, and again, thank you for the work that you do in a very large city. And I know in my discussions with my colleagues in the Poughkeepsie City School District, community schools-based modeling and things, looking at how to better utilize the school buildings for community work. And in New York City school system, your schools do that kind of work, many of them, correct? I mean, they are school buildings, community centers. They offer a wide range of not just activities, but also things that people can access to help them. And so when you're building out, right, and I think we're hearing that today, that we need to build out, throughout the state, creating new structures, creating new entities can be time-consuming, can be costly, may be difficult to do. What did you see, and obviously this probably goes back a bit, how you utilized your school buildings to meet these needs and how that's working? And obviously you talked with the chair about the funding. But I see that as, as a way for smaller communities who have the same challenges but just on a smaller scale can utilize those types of buildings for those types of services for families and children.
Sure. Thank you, Senator. Appreciate your question. I would say that our schools are the cornerstone of their communities, right? And so our families are relying on schools, not just for the education of their child, but to keep their child safe, and oftentimes looking to them for resources and supports that, are far-reaching and outside of just the educational system. And that's what we're here for. And certainly a priority for our administration to ensure that we're supporting families with all of their goals and their needs. And I think the same holds true, and you usually see this first and foremost in early childhood education, where parents are entrusting us with their child's first experience. And so in New York City, the large portion of our early childhood portfolio is outside of actually our district school system. It's through our contracted providers. And so they are a model for us in the way that they wrap their arms around the family and provide a multitude of supports. So I think there's a lot to learn from their systems and from the examples that they have set over a long-standing career and years in their neighborhoods and in their communities.
Thank you. And just as a follow-up, and this broad topic of the challenges that we face within this system, recently the Poughkeepsie City School District, the County of Dutchess, and city government entered into an agreement with the Harlem Children's Zone. And so they are now, officially Poughkeepsie is a zone location, and we're in the beginning stages of those discussions. One of the things that has certainly came out of those discussions with Jeff Canada and his team was what they do in the zone and how it is, prenatal, cradle to career, and then some, on how you can structure that, right, where you don't go so far here and then there's a gap in those services and those supports. And I look forward to working with my colleague, the chair, on some of these discussions as well, as maybe we can provide through you and others this sort of coordinated response, because one of the things that certainly in scarcity of dollars, and we know we're going to be facing that at some point in time with the federal monies, which will run out, we've got to be coordinated. We have to be coordinated. And that goes from everything of coordination of the dollars, coordination and of the regulations, how we make it easier for people to stay in the child care business, to create the child care business. We heard, from Ms. Brandt about small businesses, right? And we need to nurture the small businesses who are nurturing, the children. So I really appreciate it. I look forward to knowing more about the models through ACS and the DOE. Thanks, really appreciate it.
Thank you.
And I just want to thank you both for making the trip up here and taking the time to share your expertise, clarifying some questions that we had, and your very clear dedication to the field and some of our most vulnerable community members, our kids. And I want to work together to make sure you have the funding, all the funding you need to adequately make sure our vision moves forward. So thank you again for coming, and appreciate it. Have a great day.
Thank you very much.
Thank you.
Okay, we're going to take a 10-minute break. Give everyone a chance to breathe, stretch their legs, and we'll be back. It is 11:58 at 12:08. We will have Jessica Close from Early Care and Learning Council and Donna Anderson from Quality Stars New York. Senator, are you ready for them to start the feed again? I am ready for them to start the feed again. Sorry about that. That's okay. Thumbs up.
Yeah, thank you, sir.
So for our next panel, we will have Jessica Close from Early Care and Learning Council and Donna Anderson from Quality Stars New York. Do we have the right names?
I left them up there. Did you get them?
Thank you so much for being here.
Thank you.
Jessica, would you like to start?
Sure.
Ms. Close, excuse me.
Sorry, I'm just taking some water.
Yep.
Okay. Good afternoon.
Afternoon.
My name is Jessica Shapiro, and I'm the Senior Director of Policy and Community Education at the Early Care and Learning Council. So ECLC is the network of 35 child care resource and referral agencies, CCR&Rs, and we provide direct support into parents, child care providers, and all employers in the 62 counties of New York State. CCR&R system provides 58,000 hours of technical assistance annually to child care providers, assisting new child care programs to open, helping programs operate safely, training the child care workforce, meeting the unique mental health needs of babies and toddlers in child care settings, and more. For thousands of parents and child care providers and employers in New York State, CCR&Rs are the key to navigating a complex system. In 2022, CCR&Rs served their communities by helping more than 32,000 families find quality, affordable child care. Through the recently launched Stabilization in Deserts grants, CCR&Rs delivered grant administration to 10,604 existing child care providers and 846 prospective programs, requiring help to launch their businesses. CCR&Rs are the workforce behind the workforce. Across New York State, the quality and availability of child care programs varies. ECLC recently surveyed nearly 850 child care providers that participated in the Child Care Stabilization Grant process. Many emphasize the importance of the grant funding itself as a lifeline, but also the crucial support that the local CCR&R provided during the process. Responses included countless comments about the need for additional funding. The grants were a Band-Aid, and the child care programs are still bleeding. We also asked the survey respondents if they believe that their child care business will be open in the next 6 months. While 824 said yes, many qualified their answers with the hopes, prayers, and the needs within their communities. Child care programs deserve better than a short-term solution in a broken system. Long-term supports to increase wages in our child care teachers are crucial. At a time when access to affordable, quality child care is profoundly restricted for the working families, CCR&Rs are an integral part of how communities support child care systems. OCFS contracts that were support these services were cut in 2012 and have remained flat ever since, diminishing the breadth of services delivered by the CCR&Rs to their communities. Flat funding has failed to keep up with the cost of services CCR&Rs provide, triggering the inability to compete with their essential staff, including parent counselors, provider education specialists, infant toddler specialists, mental health consultants, referral specialists, and other skilled professionals needed to effectively support and grow child care programs. To preserve these essential services, CCR&Rs offer to working parents and expand the need in the child care sector. Increases are needed. So, by supporting the CCR&R system, the economic development of parents, families, providers, and employers across New York State will be bolstered. The child care industry has been tough on providers and parents, but it doesn't have to be this way. We need to dismantle the broken system. For too long, we have simply accepted the system inequities and made do. Progress has been made in the past few years, and we need to build on the momentum that the proposals the governor has put forth on the state of the state and the great legislation that has been championed by senators such as yourself, Chairman Brisport. Thank you for the opportunity to do these comments today. ECLC and the CCR network are looking forward to continuing to effectively serve the families and communities of New York State.
Thank you, Ms. Claus. Ms. Anderson?
Good afternoon. I'm very pleased to be here. Thank you for the opportunity, Chairman Bridgeport, as well as Senator Ralston, for the opportunity to talk with you today about Quality Stars New York, which is the state's quality rating and improvement system for early childhood. First of all, my name is Donna Anderson. I have the privilege of being the executive director of the New York Early Childhood Professional Development Institute. In addition to being the implementing agency for Quality Stars New York, we also do a variety of programs that support the workforce statewide, including the early childhood career development centers and leadership initiative, a variety of programs in higher ed, and professional development. So a variety of things, including, as I said, Quality Stars. So Quality Stars is an integral part of New York's mixed delivery childcare system. It ensures that programs have the resources and supports that they need to offer high quality services, and it's an effective way to ensure that New York's youngest learners and their families have access to excellence and the best chance to be successful. So Governor Hochul has proposed an ambitious set of changes in her budget that will greatly increase the affordability of and access to childcare for families. And Quality Stars New York really supports these goals in a variety of ways, but I want to highlight two of them here today. The first is that the number of families accessing childcare vouchers, as it increases, so does the need to ensure that those public dollars for childcare are well spent. Quality Stars serves to protect the large public investment in childcare and early childhood education by helping to make sure that those public dollars are providing quality. Second, Quality Stars New York is a resource for parents, providing resources and information about quality and helping them to find quality programs in their communities. Quality Stars is a 5-star rating system that uses research-based standards to support programs and providers across the state. Programs create quality improvement plans with their quality improvement specialists, and they work together in a continuous quality improvement cycle. Supports include expertise in technical assistance, professional development, classroom and program materials, a variety of other things. We are also supporting the early childhood workforce in Quality Stars New York by providing scholarships for teachers and leaders to earn the certificates, credentials, degrees, and teacher certification that's also a vital component to quality. In a recent analysis, 70% of Quality Stars New York programs increased their star level or sustained their high quality rating of 3, 4, or 5 stars across a rating cycle of 3 years. On behalf of the entire Quality Stars team and the more than 1,100 currently participating programs and the over 65,000 children that they serve, I'd like to thank the state legislature for the historic investment of $35 million over 3 years that was provided through the American Rescue Plan funding. With these funds, Quality Stars is more than doubling the number of programs that will be able to be served to over 2,250 programs. We're also supporting the new and existing child care programs that are receiving funding through the OCFS Child Care Deserts funding to ensure that those programs are supported to provide quality from the very beginning. In order to build on the incredible progress that we've made over the past year and a half, we are requesting an increase in annual funding from the $5 million that has been allocated each year since 2017 to $20 million in the New York State budget to really build on this foundation that the state and the federal government has already invested in to provide quality of care for New York's youngest learners, and as well as for the programs, their staff, and the children, so that they can continue to, so that Quality Stars can continue to increase and sustain quality. Thank you for your time. I'd be happy to answer any questions and specifically talk a little bit more about the workforce and some of the other opportunities and really exciting initiatives that are happening around the state.
Thank you both so much. I really appreciate it. First question's up for Ms. Claus. Just if you could repeat for us what the CCR&R stand for, and how do you help parents navigate our very Byzantine and complex childcare sector?
Sure. So they're child care resource and referral agencies. So more commonly, you'll hear Child Care Council. We do have different names all around the state, but I know the majority of them are those. Mm-hmm. But we do serve all counties, even though there are only 35. Many serve multiple counties. And we'll help parents find childcare, but we also train the childcare providers themselves. And we'll do business trainings to help employers, and we will help employers to find good locations to place employer, if they're looking to put a business in the community, we'll help them to find the location that makes sense. Very intricately with the deserts grants that OCFS rolled out, we have worked to put locations that made sense for those grants. That was the part of my testimony where I talked about the business administration, the TA. We did the technical assistance. That was part of it. Our expertise is knowing where childcare makes sense. We're not going to put it like across from a freeway where it doesn't make sense for a parent to drop their child off to childcare. It's knowing where childcare makes sense in the community is a big part of what we do, but it's really knowing the ins and outs of childcare.
Thank you. And I want to drill into something from your testimony about 2012. You said the contracts from OCFS were cut in 2012 and remained flat ever since. Can you explain more what that means? Are CCR&Rs at the same level in 2023 right now where they were in 2012?
Yes, we are. And as I said, inflation has gone up 29.7%. And so we have received the same dollar amount from OCFS on a consistent basis since then. So primarily when our CCR&Rs are hiring staff and trying to compete with competitive wages and we're only relying on minimum wage, we're not able to recruit educators and people that need to have the quality level of education that is required in the specialized assistance. Like I said, somebody who has a business background or other credentials that are needed to be proficient in this field.
Thank you. Ms. Anderson, love the work that Quality Stars does across our state. How much of New York State would you say is covered versus not covered by Quality Stars?
So there are there are currently 1,100 programs and providers. This includes pre-K programs, childcare programs in center-based care, but also family and group family and programs in schools. So if there are, depending on the numbers that you look at, between 10 and 14,000 providers and programs around the state. So we're at a small percentage of that at this point. We're working and have funding to double that in the coming year. And so, but still far from 100% coverage or even a maximum percent of coverage that would really make this a useful tool for parents to be able to identify quality childcare options in their communities.
Thank you. And you said you want to move from 5 million to 20. What would that allow you to do?
So what that will allow us to do is sustain what we are currently working on right now. So we got some of the ARPA funds, the recovery funds, to be able to expand Quality Stars. So that will allow us to maintain those gains and those additional programs, and then also to expand. So, we have a 5-year program, 5-year plan for extension and expansion of Quality Stars. And it's really driven by funding. At this point, we have made a lot of the investments that we need in the infrastructure of Quality Stars. So moving forward, most of the dollars that will go to that are really going directly into the field. It's quality improvement specialists, quality improvement supplies, scholarships, professional development, work with our CCR&R partners to provide professional development, coaching, all kinds of offerings to increase quality and support providers and programs around the state.
Thank you.
Thank you, Mr. Chair. Ms. Kloss, I'm looking at some of the notes that I had prepared for the testimony today and the discussions, and both of you mentioned the child care desert grants that OCFS offers. Who actually does an analysis to declare an area a child care desert?
So that is something that originally nationally, the Center for American Progress had looked at what the deserts were. And then OCFS had taken that on at the Council of Children and Families and the Office of Children and Families themselves. And we also, at the local CCR&R level, like I said, that's something in the community. I think we are really pride ourselves in being expertise of our own communities and knowing what we're doing. And it's something that now, as being recipients of technical assistance grants, we're looking at evaluating. Has this really made an impact or not? And we're hoping that the maps that OCFS created, if we can look and see if there was any change with these grants. Did having the recipients of the grants really make an impact? Were slots opened up or not?
Because one of the things that, when you're talking about, allocation of dollars, you can't really change or address what you haven't measured, right? And, unfortunately, the word desert is attached to a lot of things. Food deserts, medical deserts, childcare deserts, access deserts, and they're all sometimes lumped into the same place too, right? So if an area, and I know you've talked about child care councils and their work within the counties or multi-county, jurisdictions that they provide services to. Has it been, and I guess also to jump ahead, you will come in, your organization can come in and say, okay, this has been identified as a desert, or this has been identified as an area with significant gaps. You can come in and say, okay, we can set things up, because you just can't say, put a flag out in front of my house and I'm going to be a daycare center. Unfortunately, that does happen, and I was reading some of the reports. There was a tragedy yesterday in, I think it was Queens, in a daycare center that was operating illegally in someone's basement. Those are obviously the things that you all, look, to prevent. But to access your services, working in conjunction with that quote-unquote desert map, is there anything that, OCFS could do, and I think you alluded to it a little bit, as, what's changed? And is there an annual reporting mechanism for these deserts to be identified through OCFS?
We're hoping that that's something that they will undertake on a more regular basis now that this funding was instituted.
Because that was going to be my sort of ending comment, is that, if these monies, and we're going to make sure that everything we can do, that these monies are there for everyone, that those types of systems are in place so you can have the proper allocation. A lot of times you will hear from organizations and groups that, they want additional funding.
Yep.
And they probably need it. But how do you back it up to get it? And then when you spend it, is it being spent in the most coordinated way? Because again, some of these funds are unprecedented, but when they go away, then what do we do? You can't have a system that is so broad, it can't be supported with the scarce dollars that may all of a sudden be someplace. Or, if we go through another, we're talking about a recession, if that happens, what does it mean to the funding for these critical core services at the ground level? Because everybody's going to be scrambling for money, and to have those, to be able to identify and also to justify where those dollars got to go. So thank you for what you're doing, because that's what you're helping guide these conversations.
Thank you, Senator. Yeah, we are working on an evaluation survey, and similar to the one that I said I worked on with stabilization, because we do realize with those ARPA dollars disappearing, it's the justification of why we need more similar dollars.
Well, certainly keep us in the loop on that, because those are important discussions that we can have, and especially the chair can have, with these, state agencies that help this cause.
And that's one additional benefit of having Quality Stars involved with these programs that are getting desert funding, is that we can also, not only are the centers and the programs and the providers either being established or expanding, but they're being supported to provide quality care, and we can really look at that as well and make sure that they're making and sustaining gains in quality. So there's a real opportunity there to protect those investment dollars that are going in now.
Thank you, Ms. Kloss, Ms. Anderson. I just want to, again, thank you for taking the time to come here today, share your testimony, your expertise with us, your stories, and your data. And thanks for everything you're doing for children and families across New York State. Pleasure. Have a great day.
Thank you so much.
Thank you.
So for our next panel, we have Ms. Lauren Travers from the Movement of Rank and File Educators. Are they? Oh, yes, great. Hello. Good afternoon.
Good afternoon. So I am actually from the Q Studio Lab. I'm a provider in Queens. We work with more than 200 families in Queens, in Astoria, Sunnyside, Maspeth, a variety of different communities. And today, what I really want to do is to bring the inside story of what's happening for providers in New York City, across all 5 boroughs, because I'm part of a network of 100 different directors of programs who are running pre-K and 3K programs, who are not getting paid. And I know that that's been the issue, that's the drumbeat of this session today, but I don't think it's that complicated. And I think people are making it very complicated, which is, I've done this for 15 years. I've run DOE programming for 10. We've never, ever had this type of difficulty getting paid. So when there's a push-off of, oh, this is, we've inherited this, that's no longer okay for providers to hear, because it's just not true. We were paid until this September. And the only time that everyone has struggled as a group, there have been individual difficulties, including us. We've had difficulties. But this is the moment where we have to now say, we've been through a pandemic. There are programs that are still reeling with, as was also discussed, regulation difficulties, which means that the Department of Health and the Department of Education have different regulations that they put you through as a program. And programs are trying to meet the desperate needs of families right now, who are just getting back to work, many of them, and working with regulators who expect you to be up to code on everything, even though they haven't been in to see you for 3 years, right? So we're all struggling to meet the needs of everybody. But I was sent here today really to tell you what we need is not an expansion of services if those services are on the backs of CBOs in the city. It doesn't help us to expand services if, as they were talking about today, they were saying, it's bright starts, but that begins with lights staying on in programs that are already running, not expanding the problem throughout all 5 boroughs of the city. So if we want this to be better, if we want to help our families and children in the city that are desperate, it means we have to pay for what we've already contracted for. And we have to pay the providers. It's ridiculous that we're talking about 2022 fiscal year when we're 6 months into 2023 and we're patting ourselves on the back for having that paid, when 50% of the providers that we're in touch with are 6 months behind in their payments. That's unacceptable if we want programs to stay open. And these are providers who are at 11 o'clock at night saying, how do I make payroll tomorrow? And reaching out to each other. So today, what I'm asking of you is to say, I think it's time to hold the city accountable for contracts that they make with providers, to give them a 30-day of what is necessary to pay for those invoices that come in, and to make it possible for submitting invoices on time and not then blaming providers for not submitting invoices that the systems don't support to be given. So one example I will give you is if you get a September invoice and it's pending, you can't submit October, November, December, and January. So that is handed back to providers to say you haven't submitted your invoice when we couldn't. The other thing that we are asking in a lot of ways is they took the bridge loans away for small businesses that ran programming, which meant that as you were waiting to be paid, you couldn't apply for support money from the city if you were a for-profit in structure for small business. And that hamstrung a lot of small businesses who then took out loans at very high interest rates in order to stay open to serve their families while they waited to get paid for their services by the Department of Education. So my program, I've been doing this for 30 years. I've been loving serving my families in Queens for the last 15. We've expanded from serving 30 to 200 over that time. And we've barely been able to give people raises until pay parity happened in the city. So that was a wonderful thing. But now I think it's time to give the city children and families what they need. And the providers are the ones who know how to do that. Thank you so much. Thank you for inviting me here today.
Thank you, Ms. Travers, and thank you for your words. I guess my first question is, were you here earlier today for the testimony from ACS and DOE?
Yes, I was.
Is there anything you'd like to respond to that you heard?
Let's see. Let me look at my notes. I think the big piece is that the responsiveness from the overall system is ridiculously slow and encumbered. And my big thing is the invoicing system worked just fine. We were getting paid. Then this administration came in and steamrolled a lot of the administrators who were at the higher level out, which meant the people who knew how to work the systems, who you called as a provider, retired suddenly or left, so that what you were left with were analysts who process your invoice, who have no power understanding how the system works. And that has put the whole system in chaos and destabilized the entire sector.
Thank you. My other question is just referring to that panel. You know, we spoke earlier about proposed cuts from the current New York City mayoral administration, and I know our previous two representatives from ACS and DOE were very optimistic that those cuts would not affect early childhood education. Do you have any more background or perspective on the proposed cuts?
Well, I think in some ways the proposed cuts don't actually matter if the current budget's not being paid. Programs won't be around in 2024 if the current amount that they are owed is backdated 6 months. I mean, that's the problem we need to focus on. And I actually think it's something that the state could help with, because the city has to be held accountable for making a contract and then breaking it, basically by just not paying.
Thank you. Before this hearing, we went back to look at the October 2022 testimony from Moore at the City Council in regards to delayed payments. And at that hearing, Gia Lee testified regarding something that happened on September 6th, 2022. She said 300 plus early childhood instructional coordinators and social workers, policy support specialists, inclusion specialists were told September 6th at an emergency meeting at 9:30 a.m. that their positions were being eliminated 2 days before school starting. She testified that these folks were blindsided, and she had a lot to say about it. Could you expand on that and let us know where we are at today? And is there anything that is this what you were talking about just now regarding administrators?
Yes, I mean, they did two parts to it. So there was one that was that announcement, and the ICs didn't know, the instructional coordinators didn't know what hit them. And they came to our program saying, I'm not sure if I'm here, if I'm supposed to be here. Like, there was just total chaos in terms of relationship. And I think what's being jeopardized during this period of time is relationship. The whole system's built on that. And if you can't trust the person who's giving you information to know that information, you can't run a program and you can't run a system. So currently, the ICs are still working, but they day-to-day don't know what their role is actually supposed to be. And I'm not sure why the optimism is so strong at the moment, because honestly, from a provider standpoint, everyone feels like you're on tenterhooks. You don't know if you'll be able to make payroll next week. So if it's at a policy level, that's great, but on the ground, programs can't offer services that way.
Thank you.
No.
No other further questions?
Sure. Now, Ms. Travers, your operations in Queens, 200 families.
Yeah.
How many sites are there?
2.
2. And you also said something I found curious, and I wanted just to follow up with you, is that the mess of getting paid. It's obviously front and center of a lot of our discussions today. We talked about the bridge loan program. Who administers that?
The Department of Education.
So if I'm getting this right,
Go ahead.
you will go out and borrow money from the Department of Education, which is from the City of New York,
Yes.
to hold you over until you get the money that you're owed from the City of New York for your services.
That's correct.
Okay. And I'm not making light of that, but that makes
No.
absolutely no sense whatsoever. Do you, on the bridge loan program, is there interest on that?
No, it's a
Okay.
non-interest loan, but it's only can be used for payroll, and for rent.
So so what was it, and maybe it's not the case now, was it easier to get the bridge loan money than to get paid? In the traditional
In
method?
past years, yes. This year, our business, like I'm a small business in the community, so we were completely blocked from applying from a bridge loan. So we couldn't even, we had to figure out how do we make payroll. Now, like I said, I've done this for 15 years. So I know a lot of the different people and ways that you have to talk to different people. 3 weeks ago, I spent 2 of my weeks, instead of working with families, just talking to politicians and people in different offices to get paid. And we just made payroll because we got a loan from somebody else that helped us make it.
Right.
So the bridge loan program was, even as ridiculous as we all felt it is, actually did at least cover. It takes 2 weeks to get a bridge loan. It takes 2 weeks to get your payment once you submit as well. So it's not instantly anyway.
Do you know why you were saying about invoices, right? So you submit the October invoice, has been processed, you can't put the November one in, the December. I guess, again, I think it would make sense that these invoices are in the system, and then they can be looked at and paid, right? I mean, one would think. So one final question. 200 families, if you had to close your doors, where would those 200 families go?
They don't have anywhere to go. There are only 2 programs in our zip code that actually offer 3K and pre-K programs because 2 programs closed. So if we close, there isn't another program.
Thank you.
You're very welcome.
Thank you for your testimony, Ms. Travers.
Thank
It's
you.
really very, very helpful and enlightening. Thank you for
Good,
being
I'm
here.
glad. If we can give any other information, I've been told by everyone that they are perfectly willing to give the provider perspective. Because one last thing I will say is providers are rarely asked for what actually needs to be done on the ground to make this work better. And the people who know how it will work better are the providers who work with the children and families. So they need to have seats at the table.
Fully agreed. Thank you so much.
Thank you for your work and your holding this.
Of course. For our next panel, we will have Marina Marco O'Malley from the Alliance for Quality Education.
Good
afternoon.
Thank you for giving us the opportunity to testify here today. I'm Marina Marco O'Malley. I'm the Policy and Operations Director for the Alliance for Quality Education, which is also a proud member of the Empire Campaign on childcare. I'm here as an advocate, but also as a mom. I'm a mom of 2 children, now 13 and 10. Who have gone through the child care system since they turned 12 weeks old. And I'm here to say that universal child care is not a pipe dream. It's a necessary next step that will help families and children while at the same time boosting our economy. You've heard a lot about this today. I'm sure you'll hear more. And we at the Alliance for Quality Education, if you don't know us, we are an organizing group, statewide organizing group of parents who were born out of the fight for public school funding. But all throughout our fight, pre-K has been part of our platform, and more recently, childcare as the necessary foundation for public education has become part of our fight, and hence why we're here. So, as a mom of 2, I will say that when my kids started at the child care program right here at the Empire State Plaza, they learned how to be with other kids. They learned how to interact with their environment, how to hold a crayon, how to read books without words, how to do science experiments, and how to ask questions to satisfy their curiosity. They were ready to start school, and they are now thriving. I'll brag a little bit and say that my daughter as a middle schooler is on honor roll. And it's not because of my doing. But even as wonderful as the program was, it was unacceptable that my husband and I, 2 full-time professional parents, had to pay more for our child care than our mortgage. It was unacceptable that the teachers in that wonderful program that my kids attended made so little that they had to access public assistance programs for their own families. One of the teachers, who was working at the program for 35 years, made $35,000 just at the end, just right before her retirement. This is criminal, one would say, and I would agree that that is the reality of most of the childcare workforce. In fact, a Rockefeller report just the other day showed that childcare workforce is the lowest paid workforce in the care economy. So, and that was not, just to be clear, the low pay for the workforce at the program that my kids attended was not the fault of the center. But it was the system, it's the system that has been severely underfunded for decades. When a program depends on private pay families to make ends meet because the assistance rates are too low and because there is no additional state funding for the workforce, teachers are forced to make too little, which often pushes them to find different employment, destabilizing the programs and affecting children in it. And it is for these reasons that we're here today to urge you, you as elected officials and members of the Committee on Children and Families, and the entire legislature, to commit to universal child care and setting more of the foundation this year. It doesn't happen overnight. We're cognizant of that. We have, as said, the campaign has a set of priorities that lay the roadmap towards universal child care, starting with the pay for the workforce. We are also cognizant of the fact that, and the governor said so, that the uptake for families for assistance is so little, and something needs to happen about that. I was supposed to testify today with a parent from Utica who has six children, but could not be here today because she couldn't find childcare early enough so she can make the trip to Albany. And if I may, I would like to say exactly what she has told me to report on. In Utica, pre-COVID, there were 22 facilities, childcare facilities. Now, there are only 9. Only 2 of them provide transportation. And Utica, as you may know, is a small city that has a lot of immigrant and refugee families, has high poverty, and many families do not own a car. And Aisha's children go to the Thea Bauman House. She gets assistance for them attending full-time. 2 of them attend there full-time, and 4 of them are there for after school. She described the process to me of what she had to do to actually qualify for that assistance. She had to provide her kids' social security numbers, income proof. She had to provide landlord statements, and every time she drops off her kids at the center, she has to fill in timesheets and make sure that even before she qualified, that she had to have met with a DSS worker, who then had to meet with the provider, and then they had to confer among themselves to actually approve her assistance. It is a lengthy and cumbersome process, one that is often dehumanizing and strips the dignity of people, and one that people should not have to go through in order to access childcare. So, with all of that, even as dire as the situation is right now, and it's certainly better than it was last year, when we went around the state and heard from every single locality with the same issues across the board, we are still in a place where we need to make strides towards universal childcare. And I will end by saying that we are committed to staying the course of universal childcare. We will repeat that as long as we can, and to whomever wants to hear. And we will hold, we're happy that the governor made the promise that she wants to invest in childcare. We will hold her to that, and we will ask for more, because this is the foundation for our public education, for our children's future. If we are truly, truly, as New Yorkers, as in the state of New York, the beacon of progressivism, or if we're truly meaning that we want to invest in our future, there is no better place. Our budgets are our priorities, and if we invest in children, we will have a better New York for everybody.
Thank you. Thank you so much. I really appreciate you also sharing the story of the Utica parent and just the incredible obstacles she faces, not just to access childcare, but to maintain her enrollment in childcare. I also wanted to know if you could share your story. You know, you said your child enrolled here. Could you just walk us through, you know, from when you knew you needed childcare to when, you know, your child was enrolled, what the process was, the obstacles or hardships you might have faced in doing that?
Yeah. I actually started looking for childcare when I found out that I was pregnant, because I knew that in the capital region here in Albany, there were long waiting lists for infants in places that were that offer quality programming, and I had an experience. Well, I'll get to that in a second. But from the moment I found out that I was pregnant until it was, you know, safe to tell people that I was pregnant, I started looking around and talking with different families around like what to look for in a provider, in a program. I was not as involved in childcare at the time. This was back in 2009. I was just a year in and working at AQE, so I was not as knowledgeable as I am now. I didn't know that there were CCR&Rs that I could turn to give me a list of quality indicators, of things to look for and questions to ask. But the conversations with people steered us to the right direction. We had a tour of the centers, of a few centers actually in the area. We put our names on the waiting list, and we did not get into the program that we wanted to for about 6 weeks after my daughter, 3 weeks after my daughter had to be in the program. So she was about 4 months old when she moved to the program that we originally wanted her to be at. The first program she attended was lacked the investment and the quality that we were looking for, and which is why we were able to move once a spot opened up. As far as I know, there are fewer places now in our region and across the state, and you heard that same thing. And as a parent, the more important thing for me and my husband was that there was an open door policy, that people actually talked about the love and nurturing that children need. And after that, somebody had to sit down with us and walk us through the process of how do you pay the tuition and how much is that is. And this is not a joke, but our mortgage was $250 less than what we paid for childcare when we had 2 kids when my son was born, and we had 2 kids in the facility. So.
Thank you, and I just want to highlight, you know, it's really great to hear your testimony and how it plays with what we've heard previously, you know, with you know, you saying that you didn't know there were any CCR&Rs, and us hearing earlier that their funding's been flat since 2012, right. And, you know, for you, there's thousands across, you know, the state who also might not even know what's available to them. Or, you know, we heard from, you know, the quality program that wants to expand, you know, your first program not having the quality you would have liked to seen. What benefits, I guess, would you say, you know, would we see in New York if we could expand, you know, early childhood education more thoroughly and towards a universal system?
So there is 2 sets of benefits. One is the return on investment on the economy, and that is very well documented. Last year we had a briefing where we laid out the return on investment, which is quite large if we have a quality early childhood system for every child in the state. Where it was done, it returns up to, I would say, $7 or $10, if I remember correctly, in return of investment. And that includes higher wages, right? Higher wages, which means that people, that workers in the field spend their money in their community. That's also been documented in a report done by CUNY on home care workers. It's the same for child care workers. When they get paid more, they spend it in their community, and they pay higher taxes, and the return on investment is there. So that's one set of benefits. The other set of benefits is on public education. Children who attend quality early childhood education programs start formal schooling, our K-12 system, more ready to do so. Having been socialized and have been exposed to different learning opportunities, and I do not mean they know their ABCs or know how to hold a pencil or all of that. Early literacy happens in all sorts of forms, and that allows children to learn more when they are in the public, when they're in formal schooling. And that itself yields more benefits as they become adults, because children who have a good early start, graduate, go to college, get higher paying jobs, pay more taxes, and it all goes back in the community that way. So those are the two sets of buckets of benefits that I see.
Thank you. Thank you.
Thank you for being here today, and I guess your experience in 2009 in being able to be somewhat portable, right, to go to another place probably doesn't exist today. If you're lucky, right, to get into a child care program, the chances of going someplace else and you should have that choice. If you should be able to move, right? And then what happens also too, if you actually move, right? You went to another community. Some of these jobs can be portable, and so that's obviously a gap in the system. I just wanted to thank you for the points that you just made on the chairman's question of the investment in child care and what it does to the community, but more importantly, what it does to the child. Brain development, socialization, all the things. Again, my experiences as a mayor in a city that has a lot of challenges for our families and the development of that child, many coming in without child care, school district having to do a lot of other things that they normally may not have to do for larger amounts of children. Many of the schools, and one in particular, Morse Elementary School, which was my adopted school. I'm an honorary Morse Mustang because it was right near City Hall. Spent a lot of time there. And I'll tell you, my love of children was the best part of being a mayor. But Morse Elementary is in receivership. And I got to know what that meant, and the measuring tools that state ed uses for receivership. And it's complicated when you get there to get out, and you can, and they will, but all of those things are part of it, right? Because what you see is children coming into not just Morse Elementary, other elementary schools throughout the state are coming in at a lower place than they should be. And by having, the investments up front for families that are tougher now to get is very challenging for all of us to hear, but it's real. And, I know I've been just kind of saying the same thing over and over again, but I think, as the chairman said, it's good to repeat these things because everyone needs to know this. And you all know it, but not everyone else, fully grasp it because they're not there. They're not looking for daycare. They're not maybe wanting to move from one daycare to another, and they're not dealing with many of the challenges that so many of our families are. But I think for me, to be able to communicate to folks in the language that they understand, and some people may understand the economic language. Some people may understand the education language. Those are all things that need to be repeated, and thanks for laying it out the way you did.
Sure thing.
I'm going to get that tape, and I'm going to pull that out, because I'm going to use that, so I'm letting you know that. I'm going to use that.
If I can say, though,
course you can.
there is, if it wasn't clear from what I said, families' choice of whether or not to put a child in a program, or what type of program to access, is also central in this, right? Whatever worked for my family doesn't necessarily work for other families. And that and a thriving workforce is at the core of what universal child care is. And when all families, regardless of where they come from or what language they speak, when they have access to that kind of choice and and programming, and workers are thriving is what universal childcare is, and that's what should be our goal.
Thank you so much for your comments, your testimony, and your vision. Ms. Marcro O'Malley, thank you for being here.
Thank you.
Next up, our next panel, we have Lauren Melodia from the New School and Ms. Tara Klein from United Neighborhood Houses.
Hello, can you hear me?
Yes, indeed.
Okay. Good morning, Chair Brisport and members of the committee. My name is Lauren Melodia, and I am an economist at the Center for New York City Affairs at the New School. Our center is also a member of the Empire State Campaign for Childcare. Thank you for giving me the opportunity to testify today. So I'm going to focus on one foundational factor contributing to all of the many crises in the childcare sector, and that is early childhood educators' wages. As you know, New York State does not have a unified childcare system. Instead, we've layered different elements, each with their own policy supports on top of each other. And as a result, there are early childhood educators working in different settings. Some are watching their own children at home, some are running their own small businesses out of their homes. We also have early childhood educators at nonprofit centers or private schools or at a public school. Each setting has its own requirements, some of which include different expectations for workers' education. Outside of the public school system, where some pre-K is offered, early childhood educators are not earning wages on par with their neighbors and peers. In 2021, the median hourly wage in New York City was $24.50 per hour. But it was only $17.71 for preschool teachers and $14.62 for assistant preschool teachers or childcare workers, which is less than the city's minimum wage at the time. Meanwhile, family childcare providers who run their own small businesses out of their homes are paid even less. In 2019, family childcare providers were reporting annual business earnings that were 15% lower than center-based childcare workers' annual wages in the state. And given their long hours, I estimate that the typical family childcare provider continues to make less than minimum wage through 2021. Some have reported leaving the industry for higher wages in fast food and other industries. They can find better paying jobs without having to do additional training. Take, for example, that the median family childcare provider or preschool assistant has a high school diploma. In 2021, the median wage for people with a high school diploma in the city was $18.50 per hour, which is $4 more per hour than a preschool assistant was making, and almost $1 more than the typical preschool teacher who typically has a bachelor's degree or more. So given these low wages in the industry, it's not a surprise that the sector's capacity is in crisis. And in order to maintain, much less expand capacity and improve quality, early childhood educators simply need to be paid more. There are three things that the legislature should prioritize this year to stabilize the childcare workforce. First, the state needs to adopt a different methodology to determine the rate of pay at which it pays providers to care for subsidized families. Second, the legislature must enact an emergency stopgap while these and other implementation and bureaucratic issues we've been hearing about have been resolved. The legislature should establish a short-term workforce compensation fund to raise all child care workers' pay by at least $12,500 per year. This would effectively eliminate much of the wage disparities I mentioned earlier. And third, the legislature must pass legislation to automatically pass on rate increases to providers. This one hasn't really been mentioned much yet today, but facilities that accept vouchers are currently required to go through a lengthy application process to receive the increased market rates already calculated by the Office of Children and Family Services. And this means that important steps that the legislature has already taken to increase the subsidy rates for providers have still not been passed on to many of them. Together, these three initiatives can boost income for early childhood educators, which will stabilize the system as it exists now, and create the possibility of growing it to meet the demands of the future. Thank you.
Hi, Senators. Thank you for the opportunity to testify today. I was born in Brooklyn and I went to college in Poughkeepsie, so it's great to be here with both of you. My name is Tara Klein, and I am the Deputy Policy Director at United Neighborhood Houses. UNH is a policy and social change organization that represents 46 neighborhood settlement houses in New York that support their communities and people from all walks of life. Settlement houses began some of the first kindergarten programs in New York in the early 20th century, and today they run about 75 childcare programs of all modalities. We believe that we need to make sure New York is on a path to creating a high-quality, free, equitable, and universal childcare system, and that there are concrete budget and policy actions that we can take this year to get there. There's more in my written testimony, and we are a member of the Empire State Campaign for Childcare as well and support their budget priorities and policy priorities. So first, just briefly want to talk about tax credits to support young children. Research shows that economic security programs such as the Federal Child Tax Credit can reduce poverty and improve children's long-term health, educational, and employment outcomes. In New York, a survey of more than 1,000 families within UNH's Settlement House network found that the expanded federal child tax credit payments were essential to helping families meet basic needs, such as food, rent, and clothing. Currently, the state's Empire State Child Credit provides tax relief to income-qualifying parents for each child, but as long as their children are at least 4 years old. This is really a glaring omission. By excluding infants and toddlers, the current credit fails to support new or growing families, and New York needs to expand the value of that credit, as well as make sure that those families with children under 4 are included. UNH estimates that approximately 368,000 new children would be eligible if we expanded it. One way we could look at doing that is through legislation. One option is a working families tax credit, which was introduced in legislation by Senator Gounardis, and I encourage taking a look at that. Next, I want to briefly mention that New York families need access to affordable early childhood education regardless of their immigration status. We believe that the state should work toward eliminating citizenship requirements that currently exist for certain public child care programs, and we know, Senator Brisbois, you carry legislation that would do that. We are also interested in the state providing some budgetary support for this. And we've heard a little bit about the Promise NYC program today in New York City. 4 providers were chosen to run that program, and 3 of them are settlement houses in our network. And so we're tracking how that's going as the outreach is rolling out. We're hearing good things so far, but we think the state could play a role in supporting that type of vouchering for undocumented families moving forward. And then finally, I was happy to hear about all of the challenges in the workforce. We echo those concerns and support workforce enhancement, as well as supporting the Just Pay campaign to make sure that human services workers across the board are paid fairly. And I'm happy to answer questions. And I've also included some remarks in my testimony about New York City as well.
Great. Thank you both so much for being here. I want to start with Ms. Melodia. Thank you for your testimony. You said it, you repeated it frequently throughout your testimony, but I do want you to repeat it once more. What do you see as the key foundational factor that's contributing to the childcare crisis in New York?
Early childhood educators' wages.
Yeah. And in addition to that, I want to lift up what you said in your testimony about New York not having a unified childcare system, many different layers, many different agencies. Could you, I know we only have 10 minutes, but could you run us through the multitude of agencies and programs?
Can you even do that in 10 minutes?
Right, yeah.
I think that, we have like a lot of nonprofit organizations and private schools that are delivering both full day care as well as the universal pre-K program in New York City. We also have family-based child care centers out of people's homes. We have people taking care of their own children who are not paid for that labor. And then we have the public school system, which has come in to early childhood education in the past decade in a really exciting way, but it also, to echo someone who spoke earlier, has actually created other crises in those other in sectors of the industry that have been, around for a long time.
Thank you. Yeah, and I believe in New York City specifically, I believe there's 4 separate agencies that all address
Yes.
childcare. There was a childcare center in my district where the teachers were delayed from working there because they had been fingerprinted by the DOE, but had not gone through the process with the Department of Health and Mental Health, and it caused
Right.
months of delay. So I hear what you're saying about an extremely fragmented sector. I want to go to you, Ms. Klein. Were you here earlier for the testimony from ACS and the DOE?
Yes, I was.
Is there anything you would like to respond to?
Absolutely. Thank you for asking. So, we've seen from our providers that there are still a number of very significant delays in payments from FY22, from last year's school year. We know that the DOE has been taking some steps to work with providers to reduce that gap, so we're glad they're doing that. However, we recently ran some numbers with the assistance of SeaChange Capital Partners to look at the delays from FY22, and they found that as of last week, that the money owed to providers was $399 million. This is for the school year that already concluded last summer. And so we're very concerned about that. For some individual providers in our network, they are owed over $1 million. It's very difficult for them to make payroll, and they're really struggling to run high-quality programs because of these bureaucratic delays. And I can dig into it more, but we do have a lot of concerns with things at the DOE right now.
And in your estimation, this issue with late payments, would you estimate as being even close to having the issue resolved?
I wouldn't say we're close. $399 million is a long way to go, and progress has been made very slowly. We've been tracking those numbers over the last couple of months, and they have been going down, but not at the rate they need to make a significant impact across the sector.
Thank you. And could you expand more on child care and early childhood education for undocumented families? Could you just tell us more again, why is this important?
Yeah, absolutely. So currently, funding restrictions mean that immigrant families in New York can't access certain public programs. So for example, extended day, extended year programs. So they're really limited to certain programs such as New York City's 3K and pre-K programs and federal Head Start. But state money in particular can't go toward undocumented families. And so, like I said, immigrant families deserve early childhood education as well. It's an economic investment in these children and their families. We're very happy with the Promise NYC money that we saw in the city budget. It was $10 million. However, it was one-time funding, and so it's only funding from January until June of this year. So we, again, as I said, we're monitoring that funding. We're hoping that it goes well, and we are going to be advocating to continue that. That funding commitment was actually made before the recent influx of asylum seekers in New York City. So we know there are more children and families that could benefit from it. And so we would love to see some state support for that as well.
Thank you. And just for clarification for all those listening as we go into state negotiations, is it that state money can't go to immigrant families or federal money?
I believe it's state money, if I'm not mistaken.
Okay. Another issue that we've had has been pay parity for child care workers, getting their wages more comparable to public school teachers. Can you say more about the 2019 pay parity agreement?
Yes. So essentially, a couple of years ago, folks noticed there was a challenge where CBO providers who were running early childhood programs were paid far less than their counterparts who were working directly for DOE, for the school system. That was contributing to a really big workforce crisis, as we heard, and contributing to very low wages, where folks did not want to work at those CBO sites because they could get paid better at the DOE. And so there was a big negotiation with DC 37 and others that helped address some of that in 2019. And there were some raises given to lead teachers to get them more on parity. The last of those scheduled raises went into effect in October 2021, I believe. And so now there are some concerns about, it's starting to build that gap again. And so we believe that we need to take a look at that once again. There was also an issue where program directors were not included in that agreement. And so we really need to address that because we've heard from a lot of providers that they're having trouble hiring for director positions because they can get paid more to be a school principal in a DOE position. And so, yes, and special education teachers as well is a class that would be included in that. And so we're hoping that that moves forward soon and that you'll help us support those efforts.
Thank you so much. I really appreciate it, and I'll go to you in a second. I'm going to circle back to the state versus federal. I believe the governor was using the restriction on federal money around immigrant families, and I want to make a big push for state money in this year's budget for immigrant families. But yes, I'll pass on to you, Senator.
Sure, and thank you, Mr. Chairman. Ms. Klein, where'd you go to school?
Vassar.
Okay, great place.
Thank you.
Yeah, and thank you for your testimony. I want to just circle back to the pay parity. I just want to understand this. So CBO run organizations and then DOE supported. The DOE supported, is that just DOE funding or are those DOE employees?
Those are DOE employees.
Okay.
Because even the funding for CBOs technically comes from the DOE.
DOE,
Yeah.
and you talk about District Council 37. They're the representative body for those DOE employees?
Yes, for most of them.
And they worked with the organizations to assist on the other side of this as well?
Yes, in addition to the daycare council who testified earlier today.
Okay, well, that's good to know.
Yep.
Ms. Melodia, hi, thank you for being here. You used the keyword stabilization, and I think, to stabilize the system and then build out from there versus building out or, additional resources, which are obviously needed, we know that. Could you just briefly go through that? There was just a quick couple of points you made on stabilization. I know pay, I think, was part of it.
Oh, on stabilizing it, you mean the priorities for the legislature?
Yeah.
Well, I think stabilizing the income that goes to providers or making improvements to the income that providers receive is the most important part of stabilizing the sector as a whole and preventing further closures and further, employees leaving to other occupations. So changing the methodology that the state uses to determine how much a provider is going to be reimbursed for a voucher that they receive from a family that's eligible for it is one. But that's going to take some time to actually get implemented and figure out. The most important thing that can immediately happen is these short-term workforce compensation payments to all child care workers. And Dee Dee Hill mentioned earlier making sure that this is instituted as something that's not a one-time thing, but something that this is going to be here until we figure out how to fix the system. And this is not an idea coming out of nowhere. Washington, D.C. has already implemented something very similar to this. And then the last thing is removing this obstacle that providers face in accessing the market rate for the current period. Right now, they have to submit tons of documents to be eligible for the 2022 market rate. Many providers just don't have the time to do that, and so they're getting paid for a market rate price that was calculated years prior, which is lower than what the state is offering them right now. And I know you all made big efforts last year to increase the reimbursement rate, but if you are still getting the 2020 or the 2018 rate, getting an 85 or 80th percentile of that rate it's not the same thing. So eliminating that bureaucratic hurdle would actually boost income for a lot of providers pretty quickly.
And where is that system clogged up? Is that within the OCFS?
Well, as Senator Brizport mentioned, there's a lot of agencies. So,
I mean, on the market rate, in other words, the reimbursement rate.
OCFS calculates the market rate for each region. I believe other providers here will be able to answer that better, but I believe that you have to submit the paperwork to OCFS unless maybe in New York City you submit it to another agency, ACS. I'm not entirely sure.
Okay. Thank you.
Ms. Melodia, Ms. Klein, thank you so much for taking the
Thank
time
you.
to be here, sharing your research, sharing your expertise, and for your comments. I really appreciate it, and thank you for everything you're doing for children and families. Have a great day.
Thank you so much.
For our next panel, I would like to have Shanita Bowen from ECE On the Move, and also Stephen Morales from All Our Kin. I'm gonna switch your name tags. Switch your name tags. Thank you. Thanks. Ms. Bowen, do you want to go first?
Sure. Good afternoon. My name is Shanita Bowen, Director of Operations of ECE On the Move. And on behalf of Gladys Jones, founder of ECE On the Move, we thank Chair Jabari Brisport and members of the Senate Standing Committee on Children and Families for the opportunity to offer testimony on the state of child care crisis from the perspective of early care educators in residential settings. I am a former family child care provider of over 16 years. I had to close my program during the pandemic, and today I am representing family child care workforce in New York City. I'll just jump right into the systemic issues. Number one, impact of the lack of investment for family child care providers. Workforce compensation is absolutely nowhere near the mark of where it should be. An undervalued, underpaid, and under-resourced provider will yield undervalued children, and it will be looked at as the fault of the provider herself. In New York State, we have to move into a payment system that reimburses for the actual cost of care and away from the current market rate model. There will continue to be closures of programs when underfunding is in place. Providers are choosing to work in other care sectors that don't pay well, driving taxis, working anywhere just to get minimum wages, with the idea that working anywhere for low pay beats being a provider foregoing her own pay, only to barely pay assistance, let alone the rent. There is a historical focus on increasing slots for families and leaving out improved compensation for caregivers. What good is this if providers' doors are closing rapidly? Who will care for the children? We must build a sustainable system for providers as the foundation for an expansion that will provide real benefits to parents and children. That takes an immediate investment to boost payment rates that will cover the true cost of care. That includes progressive wages for providers. Going forward, OCFS, ACS, and the DOE must make reimbursement rates automatically accessible to caregivers without tedious and time-consuming bureaucratic paperwork designed to keep caregivers away from the pay rates which they all advocated for with their district legislators. ECE On the Move and others had to advocate to each of these agencies so that providers would have easier access to these improved rates. Add to that, network-affiliated providers are the clearest examples of providers who are offering quote-unquote DOE standard care and yet continue to receive pay equal to those who are not affiliated. Where is the financial benefit to being affiliated? Providers want access to resources that the DOE offers families, but if you are going to herd providers into the latest initiatives and treat them as workers with policies of when to open, how to operate, as you would an employee, then by definition with the Department of Labor, they are employees. Therefore, where is their salary? Where are their pensions and health insurances? And why did the DOE not make the market rate reimbursements automatic for this valuable workforce? Those providers received their rates later, after others did. We want to also address the lack of availability for childcare. Parents are still on the waiting list. ECE On the Move continues to receive grievance reports from families who have zero ideas where they stand on the waiting list, zero contact from ACS or HRA. During the pandemic, subsidy payments were streamlined. Parents were approved within a day or two. Providers and parents received notification immediately via email. Providers were even paid on a weekly basis. There is no smooth process by which a family may see a DOE banner advertising on the home of a network-affiliated family child care provider in her community and decide she would love to take her children there for care. This is where the ease of availability and accessibility end for both the family and the provider. From there, depending on the network, an unnecessary waitlisting begins. The control of enrollment is out of the hands of the caregiver in her own program. We want to be assured that the children of undocumented families who live in our neighborhoods are assisted with opportunities for quality child care. These very children live in our neighborhoods and our buildings everywhere. Family child care providers will not participate in the unconstitutional segregation of children, preventing them from learning opportunities that are afforded to others. We offer services to them at the cost to ourselves rather than turn them away. Lastly, concerning the lack of availability of child care, we are seeing an alarming downtrend in family child care providers serving special needs. Special needs was not allocated an increase as did the other groups. Since there was barely an uptake for this population, many are turning them down. Parents with children who are autistic, have behavioral or other needs are now finding it hard to find quality child care. They're being turned away due to poor compensation in that age group, in special needs. And lastly, and definitely most likely, most importantly, we need point people in every agency, Department of Health, Department of Education, and the Human Resource Administration, which works with caregivers and families to respond to grievance particular and to provide a process by which they may advocate for themselves. None of the mentioned agencies has a point person designated to help a provider or family with issues pertaining to specifically, intentionally, and speedily addressing a child care voucher issue or any grievance presented to a provider or parent. A point person would be charged with an immediate, same-day reach out to a provider or parent regarding any grievances and a plan in place to resolve it in a respectable manner. HRA, we have grievances from families waiting for responses from HRA. They have disappeared from the lives of families who need child care. Department of Health and Mental Hygiene continue to have their doors closed to providers. Providers must make appointments to be seen now. This was not the case pre-pandemic. Providers' licenses are on the line. Each time a licensor or registrar is not in contact with them. Paperwork constantly need approval. Licensors are poor to respond. The backlog is serious and jeopardizes the license and providers' state of compliance. DOE, there is absolutely no point person to handle grievances for providers who are affiliated with networks contracted with the DOE since the dismantle of many in the most recent DECE administration. To be clear, point people to assist families and providers in these agencies are necessary, but we are calling on the need for high-level officials in these agencies to respond to serious grievances and to provide oversight that the issues are being appropriately responded to. These are major issues that I'm presenting today. We do have grievance forms current to back up and to support our claims. We do encourage all of these agencies here today to work with us and other stakeholders who are testifying today to improve our child care system. The voices of parents and providers are needed for our own survival. When we set forth initiatives and legislation to ensure that providers are thriving, we are ensuring that children are thriving. And again, thank you from ECE on the Move.
Thank you. Thank you, Ms. Bowen. Mr. Morales.
Good afternoon, Chair Brisport, Senator Rolson. My name is Stephen Morales. I'm the New York Policy Director at All Our Kin. All Our Kin is a nonprofit organization that trains, supports, and sustains home-based family child care educators in New York City. We're also proud members of the Empire State Campaign for Child Care. I want to start by talking a bit about the vital role that family child care educators play in our state's child care system. Many parents choose family child care because of its unique ability to offer care for mixed age groups, care that is flexible and culturally responsive in a family's home language. In New York State, tens of thousands of families rely on family child care every day, including 40% of children in publicly funded child care. Despite this high demand for care across the state, our child care system remains in crisis. In my testimony at last year's budget hearings, I shared the stories of 2 educators in the Bronx who were struggling to meet the expenses of running a high-quality program. They talked about losing staff to retail jobs that offer higher wages and benefits that they can't afford to offer as child care businesses. And they also know that they couldn't raise their rates for families who already struggle to afford care. This was last year. Sadly, this year's story is much the same. According to state labor data, child care educators in New York are in the bottom 4% of all earners. Many times, family child care providers earn even less. Low wages and non-existent benefits are driving child care providers out of the field and reducing the child care supply throughout the state, as we've heard from a lot of folks who have testified today. Thankfully, the solutions to the crisis are clear. We need public investment in our child care system, starting with the child care workforce. Again, as others have mentioned, we need an immediate workforce compensation fund that offers all child care educators pay supplements of at least $12,500. And we consistently hear from educators that the stabilization grants of the past 2 years actually did their job. But those grants were never intended to solve the state's long-term child care crisis. And so now that those temporary payments have stopped, providers are back at square one wondering how are they going to pay the bills. That's why, in addition to a short-term fund, we need a legislative fix and a budget fix to transition to a compensation model that pays child care providers, as others have said, based on what it truly costs to provide care. This is what would allow educators to confidently continue serving our state's children for the long term. And lastly, we know that there are still thousands of families across the state who cannot access care. We believe the state must ensure that undocumented children have access to child care assistance and must reduce and eventually eliminate the barriers that stand in the way of families' access to care. New York can and must continue to work toward a system where every family is able to receive the child care that they need when they need it in the setting of their choice. In closing, despite the work of last year's budget, the child care crisis in New York State is far from over. We urge you to seize the opportunity to support our children, to allow parents to stay in their jobs, and to make New York State the best place in the country to raise a family by investing in the child care workforce. Thank you for the opportunity to testify.
Thank you so much, Mr. Morales. This came up in both your testimonies, but I want you to reiterate it. I want people who are listening to hear it. Describe the home-based provider model, why so many parents gravitate towards it, and why it's important.
Sure. Home-based child care providers, at their core, are professional child care educators. And they are offering care out of their homes in child care businesses. So they serve a function as both business people and professional educators. And those home-based settings often offer an intimate setting with smaller ratios or smaller size rooms. They offer mixed age care, so you can have a child who begins as an infant and stays with that same provider all the way up until even, through grade school if they stay for after school hours. And so there's also linguistic appropriateness. A lot of times those educators are working in communities. They might be your neighbor, they might live next door or down the street, and they'll speak the language that you speak. They'll be there when you need them at flexible hours. And so they're a crucial part of this workforce, and need to be compensated as such.
Besides, this is where you get individualized care. Small programs, you can serve all the needs of all the parents in different ways that they need it.
Thank you. And Ms. Bowen, I wanted to talk about wait lists. We heard earlier from testimony from ACS about the wait lists being removed, and I was curious if you had a response or if you could just share more about your experience with wait lists.
Right, we can't make this up. We actually had to open grievance hours on Fridays, 3 hours at a time, to deal with the grievances that are coming in regarding the wait lists, regarding pay, regarding slow market rate increases. So the waiting list still exists.
Thank you. The question is for both of you. So at the very top of the day, we heard from Mr. Nabozny at the Children's Agenda. We saw data of just provider closures, and by far, it was home-based providers over the past several years that are closing. Why do you think that is?
I really don't want to speculate, but I think, the financial model of running a home-based business is a little bit different. Mm-hmm. But it's hard to say. It really is hard to say. But at the end of the day, what we've heard from educators is that, and I think we've heard this from others as well, if a retailer or a fast food, place down the street is offering wages that you don't receive from either from parents who are paying privately or from our subsidized system, you're running a home business. And so those are really difficult decisions that educators are making on a day-to-day basis. And again, you have to be looking at your own personal finances. And for so many, and Shanita is an example of an educator who had to close her doors. Eventually, the math doesn't make sense.
Yes, add to that, the structure is unstable. Providers don't know when they're going to stop getting grants, when they're going to stop getting assistance. They want their pay and that the cost of care, not grants. How unstable must that sound? How scary must that sound? So even the grants that we're getting now, it's still not enough. None of it reaches the cost of care yet at this point. So we're going to experience more closures until we have a cost of care model, until a provider can pay herself, pay her assistants, pay for the quality that she wants to offer, pay her rent, support her own family. Until all of those needs are met, you're going to experience more closures.
Can I just add one more thing?
Yes.
Oftentimes, again, I've heard this from educators that they are, and I think Shanita mentioned this, when they're faced with a family who can't afford their rate, a lot of times family child care educators make the decision to take that money out of their own pockets and provide the care anyway. And there's only so long that you can do that for. And that's, again, the result of major disinvestment, underinvestment in compensation for educators.
I also just wanted to make space for a more general question. If there's anything else you might have heard from the testimonies of ACS and the DOE that you would like to respond to, I'd like to give you that opportunity to do that now.
I mean, I guess we're not asking questions, but this year, it was incredibly frustrating to have to win 80 percentile market rate and then to have to appeal to 3 different agencies for family child care providers, for child care providers to receive this. We had to appeal to OCFS. And so what the testimony we heard earlier about the paperwork that's involved, there's invoices, there's having to prove the cost of living went up for you. All of that has to be proven. Why would any of that have to be proven when we're not getting the cost of care right now? So what are we proving? And so, we had to approach 3 agencies, OCFS, who provided the form for providers to fill out to say that it only served one group of providers, to attest that they only serve subsidized children. Then we had to approach ACS to grab the other group. Then we had to approach DOE. No one came forward without us advocating for it. That should never happen. If the market rate goes up, everybody should have it automatically without having to prove that they deserve it or that they need it.
And I'd like to uplift this notion of having to deal with multiple agencies and consistently prove and reprove various things about, your provider or the work you're doing. About how much time a week would you say you spend on paperwork?
Oh, boy. Well, in the course of a normal day, we're talking about the provider has a regular day of teaching or caregiving, and we're talking about quality programming where she's operating 10 hours and doing lesson planning and observations and lunch preparation, overseeing her program, employee management. A lot goes into operating a small business. Add to that, now you've got to go find all your receipts and prove that you deserve a little bit extra in the market rate. This is absolutely absurd.
Thank you. Senator?
Thank you, Mr. Chair. I just have one question for both of you, and this is probably a question I should have asked previously. We've heard it time and time again, multiple systems, multiple agencies, multiple funding streams, having to go here, having to go there. In New York City, with the different agencies that you deal with, and maybe OCFS too, but more on the New York City side, do these systems, do they talk to one another? So and I mean that like, in two ways. I mean it both from an IT perspective, right? So if you're submitting a form into a computer and it goes to an agency, and then you've got to submit another type of form to another agency. How does that work? Because it isn't, the term that's been used so often, one-stop shopping, where you have to go to multiple locations. It's like sending a family to 3 or 4 different places, or a mom will go over there for that, go over there for this, and then eventually the mom may say, I don't have time to go to all these places to get, the assistance that I need. Where providers and organizations like you getting involved, into that whole situation where, how coordinated is even that part of it?
Okay, I'll start. So, I can think of 2 situations like that. I'm sorry, ACS have to call. We love ACS, but I'm telling you, there are so many issues here where you have the provider will see her payroll in one area online, and then she has to sign on to CAPS Online. So pay stubs and pay information is not together, and that caused a huge disturbance where providers weren't sure if they were being paid properly, because all the information should be central. That's one situation. And one area I didn't mention earlier, because it is in written testimony, a bridge is needed to support families receiving subsidies, going from HRA to ACS and connecting families and child care providers. Presumptive eligibility or something in place to give parents time to get recertification paperwork together while keeping children in the attendance, keeping provider slots filled would be helpful. Providers don't always receive eligibility paperwork from HRA or ACS. 24-month eligibility status could help ease this burden on a family when recertification issues come up, provided their work or school situation has not changed. Currently, when a family loses their spot due to slow recertification, they may lose their child care spot altogether because providers have to keep up with enrollment and fill that spot. So an improvement is needed with the ACS hotline as well. Currently, the people who answer the phone don't have all the information to address the caller and to assist them properly. This generates callbacks, which are not respectfully handled in every situation, or no callback at all. A customer service approach is heavily needed.
As a follow-up, heard consistently today that during the pandemic, during this public health crisis that we were all faced with, that things moved quicker. There was a sense of urgency on the part of many agencies that are directly involved with child care. And then out of the pandemic, it's gone back the other way. So when thinking about, we heard earlier too, stabilization and then, you know, if it worked then, do you know, because I don't know, what happened? Was there something that because of the sense of urgency, services being directed, provided quickly, because of all these things that were coming at us so quickly, which we're having difficulties responding to, was there, and this might not be the best way to sort of ask this question, and I apologize, but I think you know what I'm trying to get at. What was wrong with that system? Was there fraud? Was there services being paid for that weren't provided? If that was working, is there a way that some of that, we can go back to that? And also to, and I'll end with this, is that don't we have less people now today in some of these, we're hearing about, you know, the certain agencies and city employees losing their jobs that were directly related to reimbursement and all these other things. So if it was working then, and now we're back to the normal routine, and we got less people doing the job, that is not a model for success, so to speak, within the you know, the systems that you have to work for. What's your thought on that? It's kind of a broad topic, but I'm just curious.
Yeah, I mean, I'll just say we need fully staffed up agencies. We need fully funded agencies that are staffed up to offer support. To your previous question, we need streamlined systems that talk to one another. They're not designed that way right now. But I also don't want to lose sight of the fact that at the end of the day, no amount of streamlining is going to get us to a stable system without those, you know, those investments in the workforce. But to your point, there is a lot of, again, we need those agencies fully staffed up, and we need those systems to work together because of how complex the child care system tends to be.
Because, you know, just, and thank you, Mr. Morales, is that you want to do better. You want to provide more services. There's a need. We know there's a gap that needs to be filled, but how would you even staff that up within the structure of the systems that we already have? Wouldn't that even bring the system down farther if you had more, and you know, if you had more slots, you had more daycare centers, you had more child care, but you're going through the same process that you're going through now with more people and more services? How does that work? I mean, obviously you have to do both.
Well, that's the answer.
But geez, I mean, you know, there isn't a way that you did. There's no standalone kind of, you know, answer to this.
From our standpoint, from the provider and the family standpoint, if we need leadership to have that perspective, get behind the perspective of care, of human services, of child care, of caring for families, caring about the experience that families and providers have to go through. Be respectful and care about the process. And it starts with leadership.
Yes, it does.
Well, Ms. Morales, Ms. Bowen, I just want to thank you so much for being here, sharing your testimony, your words, your stories, your struggles. It's really important that you were here to uplift, especially the voices of home-based providers who we do not hear from enough and who play a critical role in our child care sector. Really appreciate you being here, and just enjoy the rest of your day.
Thank you so much for having us.
Thank you. Next up, we're going to hear from Casey Goodwin from Tompkins Cortland Community College. Good afternoon.
Good afternoon. My name is Casey Goodwin, and I'm the director of the Child Care Center at Tompkins Cortland Community College. I'm not only here today to represent my center, but all of the SUNY centers, as well as all the child care centers in Tompkins County. The child care crisis that has come to light due to COVID was happening long before COVID started. Child care finally became a priority in our communities, and eyes were open, to the ever-growing crisis due to COVID. During the long term, the childcare wasn't open showed the communities and the state of importance of childcare and the role childcare professionals play each day to help the community and working professionals. We all know there's a lack of childcare spots all over New York State, but why? The closing of the home childcare centers as well as some small centers. This is due to two different yet very closely related reasons. First, the lack of childcare workers. Secondly, the low pay of staff. When combined, we have a crisis on our hands today. At my center, at TC3, for example, I have not been able to operate at full student capacity for about a year due to the lack of staff. Sorry. We have spots to offer families that are in need of childcare, but we cannot find quality teachers to fill these spots due to the low rate of pay. Working at a college where you graduate early childcare professionals, most decide to go to a four-year school so they can work in the public school and earn higher wages. Our teachers are under one of the biggest microscopes in the educational entity with the regulations of OCFS, CACFP, that need to be followed, as well as NACE and Quality Stars New York standards. We have to live up to a higher standard than most other places of employment of work. We do so with some of the lowest lowest salaries in the education field. For example, a starting teacher salary at our center is approximately $31,512 for a 12-month employee, which is $16.16 an hour. According to See Through New York, the average teacher salary in the Dryden Central School District, which is located less than 2 miles from the TC3 campus, is $54,688, and that's for a 10-month employee. The average salary of a TC3 childcare center is $36,577.44 for a 12-month employee, and that's because we've been able to retain 2 of them for 23 years. This is due to a lack of funding. The childcare centers in New York, one of the difficulties we face, it takes time to reopen and remain sustainable. We are not a business that can just close their doors when a staff member calls out sick. We have to scramble to find coverage, as we're not able to just leave a child in a classroom with 1 teacher aide or a substitute for that day. Unlike public schools, we do not have a list of substitutes we can call to come in that day. Those teachers are working in public schools where they're paid much higher rates. The childcare industry has not been seen and understood for many years. The time to change is now. We can no longer stand by and watch. We need action, we need funding, we need your help. Childcare workers for nationally accredited center like ours need degrees to work to be lead teachers and certificates to be assistant teachers. New York State states that childcare centers are important, yet they do not follow what they're treating our professionals, treating our profession as the same as other professionals. The last round of subsidy for childcare centers assisted us with being able to provide a minimal increased rate of pay for our childcare workers. This small increase put their salaries a little bit above minimum wage, but it's still not a living wage for our county. The increase in DSS subsidy rates helped many families be able to pay a decreased amount in their childcare costs. However, the fact remains that some of the childcare centers lose income when DSS due to families not showing up for their scheduled times or getting picked up early or having too many absences. We cannot fill a spot for that day that a DSS child is out. We need DSS to start paying the child's weekly spot, not their attendance. How do we pay our employees? We have to put it back on the families and increase their rates to be able to pay our hourly wages of our employees. Due to this, we haven't been able to increase staff pay proportionally. Parents cannot afford another high jump. Our infant parents already pay $390 a week for childcare. Without putting it back on our parents, where's the money going to come from to pay our teachers? New York State needs to start looking at us in the same light they do as public school districts and supporting the child care centers with money each year to pay their child's teachers, especially for accredited centers that require the degrees and that provide high levels of education, early childhood education and child care. Many of the SUNY centers are hurting for staff, hurting to stay out of the red when it comes to buying supplies and paying the bills. New York State needs to step up and guarantee these national accredited centers that fund necessary to be able to continue to hire and retain qualified teachers at the wages they deserve. We are very thankful for all the subsidization money that we have received since COVID, and it truly helped us out. But to be able to pay our staff a living wage, we need to know we have funding and support available every year to be able to cover our staff's hourly wages. Please make early childcare education a priority. The professionals caring for our future deserve it. Thank you for your time, and I hope that the child care centers across New York State can count on you to come through and provide the financial support we desperately need. Sorry.
Casey, I really want to thank you for your extremely moving testimony and really making it clear how much heart goes into this sector from every single childcare worker, and how there are very clear structural and fiscal barriers to allowing you to do the work that you are capable of doing. I also want to thank you for the direct parallels you drew between childcare and the education sector. You know, a lot of people think of education as starting when you enter kindergarten or pre-kindergarten, but you know, 80% of our brains form by the time we're 3 years old, and childcare is education, and childcare workers are teachers. You know, I heard you speak about the search for finding qualified staff. Could you speak more on any staff you've lost?
Yeah, we had, because we are the local child care center in our town, the only other local child care center in our town is Head Start, and there's one school district. And we had staff with associate's degrees and bachelor's degrees, teacher certifications, but our local school districts don't want to partner for UPK. So those teachers that have these certifications to be New York State teachers, staying with us long-term, they don't get their certification for public school teaching. So they can't stay with us. They have to go out into the public school. And so people with associate's degrees are graduating right from the college we work at, and they are choosing to go to the college down the street to get a bachelor's degree so that they can work in the public school instead of staying with us. We lose people to go to different centers just because Head Start gets more money from the state than other child care centers. So we're losing them to Head Start because they can pay more.
Thank you. And can you just reiterate some of the salaries that you said you're able to pay? And I just want to make sure I heard, did I hear correctly that you have teachers that you've retained for 23 years?
I have
but
two.
Two, and they make $36,000?
No.
Okay.
The average teacher salary, I have 8 lead teachers, and the average out of the 8 lead teachers is $31,500, or, sorry, $36,500 for 8, the average of 8 teachers. And they all have to have the minimum of an associate's degree.
Got it.
Because we are NACE accredited and Quality Stars.
Thank you. This past year's budget included some measures in connection, not with SUNY, but also with CUNY regarding childcare. Do you see any potential benefits to linking childcare issues with our public universities and community colleges?
I mean, being at the community college and having some SUNY funding definitely has helped, but the amount that we get, like our subsidy went up for our students' children to be at childcare, but since rates went up, we were supposed to be able to have 2 semesters worth of subsidy for our students to attend childcare. I made it through 1 semester this year. So I had to force them all to go out to DSS, which their copays are more expensive than SUNY's copays through the federal block grant. And our operation funds that we get pay 1 month worth of salaries. So yes, it helps, but it doesn't help long term. And we're here for 12 months versus public schools that are here for 10.
Yeah. And just once more, big picture, what do you see as causing the childcare crisis?
The pay in the staff wages.
Thank you.
Mr. Goodwin, thank you. The center on the campus of TCC is like the center that is on the campus of DCC in Dutchess County.
Yes.
And the chairman brought this up because, and I'm going to follow up on this. So you do get some SUNY support. Are you a TCC employee?
No, we are not state employees. We are employed through the Faculty Student Association of Tompkins Cortland Community
Okay.
College. So we are a non-for-profit.
Got it. National accreditation.
Yes.
Throughout the entire system, obviously, that sounds like that's a pretty important thing and one that you work to get. And it's the first time I've heard that. So is every center nationally accredited? Okay, so
Nope.
that's an accomplishment, and obviously I know you're proud of that. Did you see that as a draw to your center?
We have actually had some families who moved into our area that specifically looked us up and reached out to us because they knew that we were a NACE accredited child care center and that we were regards to higher standards than regular centers that aren't.
What about Head Start? Is that, are they all nationally accredited, or is that a case-by-case basis? 'Cause
You can choose if you want to become nationally accredited.
Okay.
There's a whole
Right.
portfolio and observations, everything you go through. I don't know on the Head Starts. I do know, but Head Start's income-based, so that leaves a majority of people who can't attend a Head Start program.
Are there generally, or are there these types of centers on all community college campuses throughout the SUNY system? Do you know?
Not all of them.
Okay.
Some of them in the last couple years had to shut down on
Okay.
the community colleges. But with the big, there was funds available for SUNY, through SUNY, to be able to open childcare centers back up on all SUNY campuses. I don't know if all of them got the funding or not. We couldn't apply for it because we already had.
So I just assumed, because I never asked the question, and I was on the Board of Trustees of the community college for several years, but we never talked about the center, which was literally right down from where we met. The basis for these things to be established, were they starting out to assist students with children so they could further their education? And then, but you also have people from the community that come.
Some SUNY centers do not open it to the community, and that's what's hurting some of them because their student population with children, a lot of them are doing online classes now and not having their children. We have priority lists that our priority is the students' children, and then faculty and staff of the college, and then any open spots to the community. My waiting list kept growing and growing and growing, and mine in the county is the smallest waiting list. The one that's in downtown Ithaca has 200 kids on their waiting list. We don't because we're in the outskirts in a rural area. But we still had a growing waiting list that we were able to, because we had opened a new child care center in August of 2019, and right before the pandemic. But during the pandemic, our waiting list just continued to grow, and in September 21, we redid our entire old child care center to reopen it for just the community because as an infant and toddler center, because the needs were so strong.
Sure.
I applied for the desert grant, but I didn't get it because I'm 3 miles over the Cortland County border, which is a desert county, and I'm not. So we did it
yeah.
out of our own funds from
Yeah,
the college.
no. And do you have, not that you have the staff or the funding, but do you have the physical space for additional capacity?
We finally became fully staffed last week, and so now I can fill my remaining spots in my community center, which was only running at 50% capacity, but now that I'm fully staffed, I can fill the rest of those 50% spots.
And how many spots would that be?
It was 9 spots, because it's one infant room and 1 toddler room. We're both running at 50% capacity. And my large child care center, after the second week of the semester, any open spots I can start filling with community.
That's a good thing. Well, thank you. Appreciate what you do.
Ms. Goodwin, thank you so much. Grab a water, grab a tissue.
Yeah,
and
I'm sorry.
No, I'm sorry that we haven't done enough for you as a, as a state. Truly, I really appreciate you taking the time to share your testimony and your vulnerability with what you're doing for our children in Tompkins County, and enjoy your day.
Thank you.
Yeah. Let's take a 10-minute break. It's 2:02. Let's come back at 2:12. Thank you. Once you return to your seats, please. For our next panel, we will have from Westchester County, Kathy Hollis from the Child Care Council of Westchester, and Dawn Mayersky from Mount Kisco Child Care Center. Thank you. Good afternoon.
Good afternoon.
Thank you for being here.
Thank you. Hi. I thank you for this opportunity to speak and share the challenges being faced by child care centers. My name is Dawn Mayersky. I'm the Executive Director of Mount Kisco Child Care Center, co-president of the Westchester Early Childhood Directors Association, member of the Empire State Campaign for Child Care. We are NACE accredited, my center is NACE accredited, and we are a Quality Stars program. I ran a Head Start classroom at the Morse Elementary School in Poughkeepsie for about 30 years ago. Mount Kisco Child Care Center stayed open during the pandemic, and we never closed our doors, and we did what child care centers do. We did whatever we had to do to meet the needs of families and children. I have been in the industry for 40 years. I know I look too young. 40 years. And the issues that we advocated for back then are not any different, and in fact, just simply getting worse. Child care is on the brink of collapse. The high cost of care and low teacher compensation is causing this crisis. The only guaranteed funding available to child care centers comes from parent tuition. With infant and toddler tuitions close to $2,500 per month for just one child, even middle and upper income families are struggling to pay the full cost of care. This rivals college tuition and their mortgage. How much higher can tuitions go before parents must decide to leave the workforce or explore less expensive options that will likely be pointing towards unregulated care? Half of the children who attend my center pay the full fee to attend, and half of them receive scholarships and subsidies from the county. Infant care in my program costs $24.23 per month. The reimbursement for an infant who receives a subsidy is $16.36. That means that we have a shortfall of $9,600 per year per child for every infant or toddler that we take into the center. Reimbursement rates must be calculated based on the cost of care rather than by market rate surveys. To comment on, you asked why there are fewer people in the program. Well, part of the problem is that because the reimbursement rates are so low, centers are starting to say, we can't afford to take these kids anymore. And why do 50% of the parents not complete their application? I can tell you why. Because if you are working for an employer and you're a housekeeper or a landscaper, and you have to go and ask an employer to write a letter that says how many hours you work there, and those employers will not write those letters. They are afraid to write the letters because they're afraid of immigration repercussions. So that's a big part of why the applications don't get complete. We are a 501c3, so we are allowed to engage in fundraising opportunities, and historically, we have to raise $650,000 every year to provide the scholarships that we do for low-income families. Not every center has that capacity, and it's becoming more and more difficult for us to access those kinds of funds. But the people who can't fundraise are really struggling to be able to make ends meet. We have a waiting list with more than 250 children on it, mostly infants and toddlers. There are 2 Head Start classrooms in our building that are fully furnished with a waiting list and no children in them because they can't hire the teachers. They can't find teachers to run the classroom. It's the saddest thing to walk through that space. We are finding that teachers are taking jobs in Target and Starbucks and other national chains for better hourly rates and benefit packages, and I'm going to share this one story. We had a teacher who kept calling in the morning. She would say, I have a headache, I have to take some Excedrin, and then I'll be in at around 11, and I walked into Starbucks that morning to get my coffee, and there she was working at Starbucks. And so these teachers are just not able to make ends meet. They have to find ways to supplement their income. Can't do it that way, though. UPK classrooms operate on a school day schedule. This is not a working family-friendly option. And the state funding that comes to UPK streams directly to elementary schools. The community-based organizations must be chosen by the elementary school in order to be able to run a UPK classroom. At the high end, the reimbursement rates for a UPK child is $10,000. And then the elementary school decides that they have to take $2,000 of that for administrative costs. So now you're trying to run a classroom for children at $8,000 a year. There's just no way that that can be cost effective, and you have to have a certified teacher. So there's no way to make that cost effective. Linking childcare to hours that parents work underscores the notion that we are simply babysitters, yet we do so much more. Teachers provide rich environments that foster cognitive, physical, and social development to a diverse group of children. They are required to care for each child's needs while preparing them for kindergarten, along with teaching resilience, perseverance, how to manage their emotions, become part of a community. We had a little boy who was diabetic. The teachers had to learn how to do insulin. If you have kids, we take care of all of their medical needs. And they do all of this during the child's most formative years, and they barely make minimum wage to do that. The American Rescue Plan had a huge impact on childcare. It gave us a glimpse of what could be possible. We were able to increase salaries with funding that came directly to childcare, was not linked to public schools or low-income children. The challenge now is how do we sustain those increases now that the funding has come to an end? If we were to increase wages to $18 per hour, we will end up with a $250,000 deficit. Childcare was considered essential during the pandemic and was not even mentioned in the final reconciliation package. The childcare workforce is grossly understaffed and underpaid. There must be a robust plan for increasing compensation in a significant and sustained way. Thank you.
Thank you.
Good afternoon. Thank you very much for the chance to speak to you today. My name is Kathy Hallis. I'm Executive Director of the Child Care Council Westchester, Child Care Resource and Referral Agency I've had the privilege of directing for nearly 20 years. Earlier in my career, I ran a Head Start Center for children who were homeless, an experience that still drives much of my work today, because it was there that I saw how poverty and family disruption and lack of access to play and books and fresh air, what it costs young children. But I also saw how skilled, caring early childhood teachers could heal some of the damage that had been done, and in its place instill trust and joy. Throughout the pandemic, OCFS launched multiple federally funded initiatives to help working parents and preserve childcare programs. The last state budget expanded eligibility, increased reimbursements for childcare, reduced the parent share, and more. We're very grateful to the governor, the Senate, and the Assembly for these important steps forward. The governor is proposing to make childcare affordable for even more New York families. Her plans to simplify the Child Care Assistance Program and to launch another workforce retention grant program are positive as well. But the child care workforce, without which there is no child care, needs much more attention, and it needs it now. The compensation problem in child care is not new, but it gained visibility during the pandemic. Business leaders, economists, elected officials, parents, and advocates all insisted that childcare had to be protected and expanded, and the compensation gap remedied. The U.S. childcare system only exists because there have been women and men, mostly women, and often women of color, who have accepted marginal wages because they wanted to care for and educate our youngest children. But given the evidence that the first years are the most important years in the educational cycle, how can we continue to justify paying childcare educators little more than minimum wage? It was never right to do that, and we cannot do it anymore. While childcare must be more affordable for more parents, we cannot stimulate demand for more childcare, as the governor pledges to do, without ensuring that the childcare workforce will be there. Last week, I met with 25-plus directors and owners from all over Westchester. Don was one of them. Their programs serving families across the economic spectrum. No one can fill staff vacancies. New hires don't last the month, and the staff who remain are exhausted. And when you are not fully staffed, you cannot fully enroll. Some programs have waiting lists of 80, 100 children or more, and Don said, yours is 250?
250.
The staffing crisis is crippling all our childcare programs, not just those serving families of limited means. Programs that serve higher-income families generally do pay higher wages, and many have raised their fees as a result, but there are limits to this strategy. A particular Westchester center, which charges $25,000 a year for an infant, pays the head teacher $16 an hour, which is equivalent to $33,000. If the director goes to $26 an hour to stimulate more teacher candidates to apply and stay, then the cost for that baby jumps up to $33,000 a year, pricing that program beyond the reach of many of our families. The fact is that most parents, even those with significant incomes, cannot afford the full cost of quality childcare by themselves. New York knows what it needs to make our childcare a world-class system, one that will attract and sustain the young families we need for a thriving economy. Childcare businesses need a commitment to significant and ongoing increases in workforce compensation, not one-shot workforce initiatives. Let's be clear, hopes were raised by Build Back Better, but New York State cannot wait on the federal government. New York State must invest more of its own resources in our childcare workforce at once in this year's budget. So my question is New York State ready to do that? Thank you.
Thank you, both of you, so much for those fantastic testimonies. I want to go back to some of the graphs that we were looking at the top of this hearing. This one zooms in on New York City and the suburbs, Westchester included. Looking at the numbers, do these align with your experience over the past few years? This is the number of child care programs operating in New York State and percentage decreases.
Well, I can't really tell which segment is Westchester, but I can tell you that we lost at least 50 programs over the course of the pandemic, many of them home-based childcare programs.
What does that do to a community when a childcare center or childcare provider closes down?
It sometimes means that the families can't go to work anymore.
Yeah.
There's a spiraling effect.
And panic ensues. The existing centers who are already fully enrolled get all these calls. My childcare is closing. I don't know what I'm going to do. And, you try to do everything you can to help as many as you can, but we're bound by strict licensing regulations, and you can't go over maximum enrollment in the classrooms. There's no place to expand right now, and so you just go home, feel bad.
And then clearly they run to another child care center and get on the wait list.
Right.
And Ms. Myers, you said you're at about 250 now.
On the waiting list, yeah.
Do you see any trends over the past years, the wait list getting longer, longer, shorter, staying the same?
This is the longest waiting list that we have ever had. And I think part of it is because, there's a whole bunch of things that are happening. There are centers who are not able, who are operating but have closed classrooms because they can't hire staff, and so there's not as many spots for the infants and toddlers right now. I think, I'd like to think that because we are NACE accredited and the Quality Stars program, we are desirable. People want to come to a program like ours, so they're looking for that high quality, and I just think there are just not as many places for them to go right now. And there was a big migration from New York City from the pandemic. A lot of people from New York City came up to Westchester, and that also caused a higher need for childcare.
I might have follow-up questions, but
Thank you both for being here and being familiar with the Mount Kisco area. Because my sister-in-law and brother-in-law and goddaughter and nephew live in Katona.
Okay.
So spent a lot of time in Mount Kisco. The people that are on your waiting list, and the children that you serve, but the waiting list in particular, what's like the geographic area of people who are on your waiting list? I mean, how far will people travel?
Geographic? So it's Mount Kisco, Chappaqua, Bedford Hills. We get families from Yorktown, Somers, down Armonk. So it's for the early childhood programs. For the before and after school programs, it is pretty much limited to the Bedford Central School District. So that's the Bedford District.
And the point that you made about employers not wanting to fill out the paperwork for people who are undocumented, but yet have working here and been here for a long, long time. I guess the point is that through an educational process, right? I mean, sometimes people fear things that aren't necessarily have to be feared. And we heard this in testimony earlier. That's with individuals who did not want to do themselves, wanted to do paperwork because they're afraid that that paperwork will go to immigration or it'll go someplace where generally it doesn't go. I mean, what's your suggestion on breaking through that barrier? Because it is something that we see in so many areas where, people won't report crimes because they don't, they're victims, and they won't even, seek help and justice there because of their, they're worried about, having something happen to them when it's not necessarily going to happen.
So I have a social worker on staff, and a big part of what she does is she helps the families get on this, apply and get on the subsidy and then stay on. Part of what happens is she'll call and she'll try to explain to them that this is nothing to do with IRS, this is, immigration. Yeah. But that it's really just they just want to ensure that the person is really working. But then what happens is DSS actually shows up at their house to make sure that that person is there. And if that person has been sent out to the dry cleaner to pick up the clothes and she's not there, they fall off the subsidy. They have to start all over again. Even if the employer standing there says, no, I just sent her to the dry cleaner. And for the people who are employing them, they don't want that intrusion in their lives, and I can't say that I blame them.
So in other words, both on the employer side, right, if there's some sort of checking there.
Well, they go to the house to check and make sure, like if you said that you are gonna mow my lawn on Tuesday, they'll come on Tuesday, and if you're not there mowing my lawn.
Oh, I'm sorry, I misunderstood that, so that's what they do. Okay.
You're not there mowing my lawn, then you fall off the subsidy. And for the person who is employing you, they have this person coming to their house saying, where's the person you said that you employ? Right. And so it makes it uncomfortable.
But I would argue that high-quality early learning experiences should be available to children regardless of what the parents are doing and not doing. Should be completely uncoupled from that. On a more pragmatic level, I would say, in my child care resource and referral agency, we do have 2 subsidy specialists employed who are bilingual, who will go out into the community. I think it's easier sometimes for parents to come into a non-public welfare type, environment. So I think that has helped us engage more families and then also sometimes engage their employers. But again, I think what's more important is it's good for kids. It's great for kids. We need them to have it, and let's get it to them without all this other.
That would be what we should always say.
Yes.
It's about children.
Yep.
And everything we do and every decision we make, wherever it may be, what's the effect on a child? Right. A child that we don't even know, when you're investing resources in a variety of things that government does. Right. Always, you can never go wrong by sort of starting off with that mindset. Well, how does this impact the kids?
Right. I mean, I do find myself talking a lot about the economic development ramifications of this. We are increasingly being contacted by employers who themselves are saying they're having trouble, getting staff and retaining staff. But recently, one employer who hopes to expand and add 2,000 employees specifically asked us if the supply for childcare is going to be available in the community for round-the-clock care. It's not there. So, any, I think, initiatives, regional or statewide, to really grow the economy, have to be linked with investments in childcare.
You had asked earlier what things could happen that might help make staff retention. I'm going to tell you the number one, aside from increased wages, affordable health insurance.
That would help.
Huge, huge. We are crippling ourselves trying to provide health insurance for our staff, and it's not great insurance to begin with. And so, some way to provide a consortium even so that childcare providers could all get their health insurance so that it would become more affordable, that would be huge. Of course, retirement plans. Also, somebody else mentioned it, because the numbers are so low with staff, if you know, you can't leave a classroom if it's not in ratio. It doesn't matter if you have a doctor's appointment or what's going on, you cannot walk out that door if that classroom's not in ratio. So having access to a consortium of substitutes, like if OCFS could create a license number that would be for substitutes, so that they would be have a background check, be screened and cleared, and then any center could call those people, have a list and call those people to help substitute during the day, that would be huge. I have to pay a full-time salary for a substitute, whether I need them or not. I've never not needed them, but but it would be great to just have access to substitutes. It would cut down on that burnout a little bit. I think those are like little things that are doable, that could happen, that could go a long way towards making a difference.
Can I ask a few follow-ups?
Absolutely.
Thank you for that, and I love those suggestions of the healthcare and the substitutes. I want to return to this graph and just highlight, so the Westchester County is the one that is the minus 5%. That decline in childcare programs. So I want to highlight that to put things in context for other regions of the state too, and I want people to, we're hearing now that even that a 5% decline, which may look like a small number, has led to the longest wait lists you have ever experienced, in your time as a provider, which really elucidates, how limited the number of providers were to begin with. Right. And just keeping that in mind as we look at other parts of the state, later in the hearing, and how they've even seen like even larger decreases in providers. I also just want to get your perspective of just the level of bureaucracy and the number of agencies you're dealing with. I know earlier we talked about New York City. It's 4 various agencies. I know you mentioned DSS earlier. I assume you also, now that UPK is in Westchester, you work with the local Department of Education too. Are there any others?
No, certainly
OCFS.
Our situation, I think, is certainly easier and less complicated than that of the city. And while we welcome investments in pre-K, the fact is that childcare is a series of markets in various communities, and any change in any aspect of the market affects the rest of the players in the market. And there's no coordination between what happens with SED and what happens with OCFS-funded programs. And certainly, staff have been lost to SED-funded pre-K, but probably the bigger problem is when a school district decides to operate pre-K by itself without contracting with a community-based program, and it sucks up all the 4-year-old children from the community, leaving the community-based players with younger and more expensive children, it's ruinous. And that has been happening all over the place.
Thank you. Any follow-ups?
Yeah, just want to get back, Ms. House, to the prospective employer that had, checked out, what the child care situation was. What did that employer ever locate in Westchester, or did they,
Well, they are currently in Westchester.
Okay.
But they are, I don't want to say too much, but they are waiting for some other things to happen.
Of course, within their plan?
Yes.
Yeah.
Yeah.
Do you know of, because that presents an interesting equation. So maybe it would be a new employer, someone who's going to be building a brand-new facility someplace. We see a lot of it in the Route 84 corridor.
Sure.
In both sides of my district, in Dutchess County now, really starting to ramp up in the 84 corridor in Orange County. Is that have you ever heard of a way where these employers would want to locate to a certain community for a variety of reasons, economic, could be IDA incentives, to say, okay, we understand there's a desert there, right, of childcare. How do we, as the private sector, help, the childcare industry by maybe helping with subsidy of wages, right, to attract people to come to those organizations that are either existing now and need to staff up, or it would be created. I'm wondering if those conversations have ever happened, and maybe they should, within that economic development apparatus, of that county. Because it seems that, you know, besides the things that are barriers to establish jobs, and there's lots of them depending on where they want to be established, that's a big one. Because you want to be able to say to your prospective employers, if people will be coming into, you know, into that area, to say, yeah, there's childcare here.
So we've had remarkable support from the business sector, the Business Council of Westchester, Westchester County Association, our county executive, the director of the Office of Economic Development. They all get it. One of the other things that seems to be happening is, I think, a more stratified, if you will, system of childcare. Several years ago, Pepsi's international headquarters is in Westchester, and they did a survey and found that 300 people in their employ wanted childcare. They built their own center on their campus. Regeneron is building its own center on its campus. So some of the larger employers, some of the, you know, real recognizable employers are going that way. They are paying higher wages for the staff, and I'm happy to see staff make something that, you know, maybe allows them to pay their own bills. But that, too, is going to make it difficult for the other community-based programs who are trying to serve people who work for smaller employers who can't afford any of that. Now, I understood that last year there was some movement on a new tax credit, an employer childcare tax credit. I don't know where that stands. I mentioned that to a number of smaller employers. There was great interest in that. I think people, not every employer is interested in citing a childcare program on their campus, right? But I think increasingly they understand that if they want to have people show up for work and be focused on work, they have to be part of the childcare solution. So I hope that there's some movement this year on that tax credit as well, because there's absolutely an appetite for that.
Right, because obviously those types of you know, conversations with large corporations aren't going to be happening in cities.
Right.
And other communities that just aren't, they're not set up for that kind of, you know, employee operation or a big, you know, warehouse or whatever it is. But, well, thank you for that perspective. Appreciate it.
And that, maybe 10 or 15 years ago, we even had a deal with IBM where they were funding us and helping us to become a credit. And in exchange, they got priority slots in our center. And so anybody who was from IBM just moved right to the top of the waiting list when they came in. Those kinds of situations could really make a difference for childcare centers.
Yeah, well, thank you both, truly. This is very, very informative, and again, I just really appreciate how much work you've been putting into this. Your career is in this field. It's very clear, and thank you for your time and your testimony today.
Thank you.
Thank you for doing this today. Thank you.
Thank you.
Thank you for listening.
Oh, of course. For our next panel, we have some speakers from Western New York. We have Diane Abram, a home-based provider, Rosalind Cheatham, another home-based provider, and a center-based provider, Felicia Williamson. Good afternoon and welcome. It's working. Okay, there we go.
Hello, Senator Brisbois and members of the committee. I'd like to thank you for holding today's hearing. I am Diane Abram, group family daycare provider on Buffalo's East Side. I've provided high-quality in-home childcare for over 32 years. I am the founder of Workforce Solutions Consortium, which is a nonprofit organization for family daycare providers. And I'm also a member of the Western New York Child Care Action Team. What I'd like to talk about is families, children and families, and what their needs are. That's what I like to focus on for my few minutes. The greatest need for many is to have reliable, affordable childcare. A lot of people think that wait till they get to school. You know, once they get to school, you know, everything will be okay. That's wrong. As long as there are no system of care education, and support for the developing children during these critical years, we will continue to lose valuable adult workers at Thriving Children. How much would you be willing to pay to ensure that your infant, your toddler, your 3-year-old, and your 4-year-old or grandchildren's brain developed to its full maximum capacity for a bright future? An ideal environment which stimulates brain development must include a lot of interaction with a caregiver who uses language, music, art, play, and relationship development to enhance emotional intelligence. Are you willing to pay as much as it costs to provide the best environment for your children and your grandchildren? Early childhood education to ensure that they have the best foundation to grow up and become successful citizens who can actively contribute to our society. Decades of early childhood education research has found that children with access to high-quality early childhood development programs and healthcare opportunities are better prepared for kindergarten, they do better in school, and they are more likely to graduate and attend college. The grants were helpful, but they were simply not enough to sustain our child care businesses. I speak on behalf of many who find that it is a gross neglect for our government not to substantially increase funding to support the hundreds of struggling essential child care businesses. Thank you for the opportunity to testify. I welcome the opportunity to answer any questions. My colleague and I would love to share many success stories that we have of the children who came through our early child care programs. Thank you.
Thank you.
Okay. All right, well, thank you for this opportunity to share my testimony. My name is Rosalind Cheatham. I am the owner of Our Family Daycare. We are, first and foremost, I am a 24-hour daycare. We are open 7 days a week, and we're located in the heart of Buffalo, the African-American community, the heart of the African-American community in Buffalo. It's on Buffalo's east side. I'm a member of Workforce Solutions Consortium and also the Western New York Action Team as well. And I am here to let you know how, as providers and a daycare owner, the struggle is real for childcare business owners. New York's childcare businesses are in a crisis more now than ever before. Pre-pandemic, we faced staffing concerns and low cost of care subsidy payments. Now, post-pandemic, we are facing those same concerns in addition to inflation and the ability to maintain the staff we currently have and hire additional staff to fulfill the child care desert needs. Help me make it make sense. It has been said that quality child care is essential. It has been said that child care is essential for working parents to earn livable wages. I started my child care business 21 years ago when my first child was 4 years old. Today I have 3 children and I'm still operating an in-home group family child care business, where it is my duty and responsibility to provide quality child care to working parents so they can earn livable wages. As a provider and a parent, I struggle to provide for my family because my child care business is 100% subsidized and underpaid. And my question is, where is it my responsibility to provide for my family? so I can earn livable wages and provide for them as well. Help me make that make sense. To operate any childcare business today, we are faced with three major concerns: inflation, staff-to-child ratios, and low wages. Food prices have increased. Prices for health and safety materials have increased. The insurances that's required for us to operate our daycares have increased. General liability, general daycare insurance, general liability, workers' compensation, utilities, gas, lights have all increased. We cannot fulfill the childcare desert without quality staff. It is simple. Quality childcare teachers are not coming back without better quality jobs that pay better wages. We need to be able to offer better wages, health insurance, retirement plans, and pensions just to be able to level the playing fields with major corporations. So help me make it make sense. How can we afford to do our jobs on what we make today? How? How can you help me to make it make sense? Is by setting subsidy reimbursement rates based on the actual operating costs, by paying providers based on our enrollment versus the actual child's attendance, increase the use of contracts and grants, invest in the workforce, support development of shared services, alliances, and family child care networks, and engage in stakeholders to develop a vision for universal child care. That's how you can help us make it make sense. Thank you.
Thank you.
Hello, Senator Bridgeport again, and Senator Rolson. Thank you for the opportunity. My name is Felicia Williamson. I'm the owner of My Precious Angels Child Care in Buffalo, New York. We've been serving the community for 19 years. I'm also a steering committee member of the Western New York Child Care Action Team. Imagine our employees graduating from college with an early childhood degree, working in a field which would have a positive impact in a child's life. Now take a second and visualize that same person living in poverty. Most daycare owners and staff do not receive a livable wage and are eligible for Medicaid benefits and food stamps. Imagine owning a child care business for 30+ years only to retire and get $1,000 a month in Social Security benefits. Most daycare owners cannot afford to pay themselves and cannot afford to invest in a retirement savings plan. None of us will retire with a livable earning or a pension. With inflation and the increase in minimum wage annually, we can no longer offer our staff a competitive wage. We have closed classrooms, and some providers have closed businesses, as you've heard all day today. The current child care crisis is not surprising because it's been brewing for several years. The one good thing that has come out of the COVID pandemic was that it showed how important child care facilities are to the workforce and to essential workers getting to work. Without child care, families are forced to make tough decisions. We take care of the community's children, our neighbors' children, and even your children and grandchildren. Why wouldn't you want to help child cares continue to provide a child's educational foundation? Now, imagine permanent fluid funding to provide free child care to all, like elementary schools and high schools. Imagine our classrooms remaining full, allowing us to pay our staff a better wage. Imagine our businesses growing, allowing owners to invest back into the communities that they serve. Imagine families not being stressed with the financial burden of child care and returning to households where both parents were able to go to work. Imagine daycares receiving funding for what it actually costs us to operate our facilities. I encourage you all to review the cost of care study done by Cornell University, and I know they were here today, so please take some time to review that if you haven't. As my colleague Rosalind Cheatham mentioned previously, and I want to reiterate it because it's very important, employees are not coming back to the child care industry unless there is change. And a couple of highlights that I'd like to use of hers was we need set subsidy reimbursement rates based on actual operating cost. Daycare providers should be paid based on enrollment and not attendance. And lastly, we need increased funding for grant opportunities. Now imagine a change. Universal child care will help more families get back into the workforce and allow their children to be placed in a setting that prepares them for school. This will further develop the workforce and help grow our economy. Now that you have imagined all of this, we need your help to secure adequate funding for the survival of the child care industry. Thank you for allowing me this time.
Thank you. Thank you all three of you so much for your testimony and for making the trip out here from Buffalo. I really appreciate it. I know it was a journey. I want to turn our attention to the screen real quick. You can see out in Western New York the change in enrollment over the past 10 years. And I just really want to really make it clear that, that shouldn't be read as, less parents wanting to enroll their kids, but more so that we have fewer teachers able to allow for that enrollment for many of the reasons that you've been saying. Ms. Williamson, I'm glad you brought up the Cornell study. I had a few questions for all three of you based on the study. One thing in the report, it noted that child care providers in your region reported working an average of 25 uncompensated hours weekly. That's on average. That is a lot of uncompensated labor. I would say that is exploitation. Is it common to perform uncompensated labor in Western New York?
Well, with other fields, it is definitely illegal, but it seems like OCFS think it's okay for family daycare providers to work extra like that, and it is very common with your in-home daycare providers. Basically, when you work with, like myself, with my daycare, 32 years as a family daycare provider, we do everything. We cook, we have to do curriculum planning, we have to go shopping, the whole 9 yards. But our reimbursement rate from OCFS, 6 hours, you care for one child for 6 hours, and then you care for another child for 10 hours, you get the exact same dollars, okay? And so with many of our family daycare providers, because we have extended hours, we may have a parent who might work from 10 to 7. And then we have children that come at 6 a.m. because they're before school children, or we work for, we do a lot of, we care for a lot of children of parents who may work as CNAs or work at the hospitals and those. And many of our parents are low-income families. And so those parents have a lot of non-traditional hours. That's one of the reasons why our hours go so far and beyond.
Thank you. I also noted in the report the average annual wage for full-time childcare workers in Erie County is just over $23,000 with a median hourly wage of $10.38. Does that sound accurate to you? And is that enough to get by on in Western New York?
That's accurate for staff, but me as a provider, oftentimes I've made less than what the staff is. I have made, in 2021, when I calculated the hours I worked, I made $8.30 an hour.
This report also found that in Erie County, the child care workforce is currently between 3,100 and 3,300 people, the lowest it has been in over a decade, suffering an 11% reduction just between 2019 and 2020. Does that reduction in workforce sound accurate to you, and how has that reduction in capacity impacted both your work and also and just the community at large?
Well, the reduction in workforce comes from during the pandemic as well. A lot of people started to work from home and really didn't need childcare as much as well. But the information is accurate. We are seeing a low amount of people returning to work post-pandemic.
Thank you so much.
I heard the term absence and attendance, right, and based on the reimbursement. So If that was changed, if it was on your enrollment and not, based if someone wasn't there, what kind of resources would that bring you financially? How would that help, and how would that increase? How much money would you see potentially? I know it would probably vary by size of the daycare, but
It would vary, but it would just be an increase in revenue, because right now, when a child does not attend, we're not paid. It's not based like, if you look at the city of Buffalo, the school system, each child, they're paid for each child. We're not paid based off of the children that are enrolled in our centers. We're only based off of if they attend. I have this child that's enrolled, and I expect this child to be here all week, but the child only comes one day. Instead of me getting paid the minimum right now, maybe $300, instead of me getting paid $300 for that week, I'm only gonna be paid $25 because it was a part-day rate. It's not stable. There's no stability there.
do you see, and because I know I had dealt with this with talking about Morse Elementary School, before. One of the things that they had a high absentee rate because they had single mothers that had to stay home, and Poughkeepsie is a walking district, right? So they would physically drive their children to the elementary school, and if one of their children was sick, she couldn't leave, her place to take the other student to her other child to attend school, therefore, spiking the absentee rate. Do you see that also too, probably in daycare? I imagine you would, right? If someone can't physically leave their home to bring their child to daycare because their other child is not well, and and obviously they don't have another place to put that person because they're going to come to your daycare to utilize your services. I guess it would, and I would imagine too, and if this is the amount of children served and the amount of money that you would be getting from, say, OCFS, I wonder how much money are they saving based on that calculation? I mean, because if we're in a situation now where every little bit helps, maybe that's something that needs to be looked at. I'd love to know what the answer to that is, Mr. Chairman, because maybe there is a way at least to have that discussion as well. But because it's interesting, it's different than the school district, and what we've heard today is you're doing the same thing. Right. And you're preparing these kids to go to the school district.
Yes, we're in the school district.
And can I also add back to your last question, the difference that it would make in paying us for the enrollment versus the attendance. In Erie County, we do get paid some absences, but then after those absences run out, we don't get paid. And if it's a household where there's multiple children, most of the time, if one child is sick, they're keeping all the children home sick. So once we run out of our absences, we don't get paid for those children. So the effect that it would have on us getting paid for enrollment would be, as an owner, I know that I'm guaranteed this amount of money, and I can staff according based on that. How can I do a budget when I don't know what we're going to be paid for the year based on absences?
You can't.
Right.
Right.
In addition to that, is because it's a staff-child ratio, oftentimes I had to keep staff because I didn't want to lose them. Now, say, instead of me having 8 kids, I'm supposed to have 8 kids, but I only have 4 kids. And then my assistant, I look at my assistant and I say, oh, I only got 4 kids today, so you can go home. How many people are going to continue to work when they don't know how many hours they're going to get? And so it's important, if we got paid for enrollment, it would really help us maintain and keep staff based on, what we hired them as, part-time and full-time.
Yeah, I mean, it really is common sense what you're asking for. I was a public school teacher before I was a senator, and I got the same salary whether or not my students had perfect attendance or if they missed a few days, so by enrollment versus attendance. I do want to thank you for your incredible testimony today and also for making the journey out from Buffalo. I really appreciate it. It was very necessary to hear your stories and your struggles, and I'm looking forward to making sure our state budget reflects how needed and how essential your work is.
Thank you.
Thank you so much.
We appreciate it, and we're willing to take this trip anytime you need us.
Anytime.
Next up, for the next panel, for the North Country, I would like to call Rose Blanchard from the Adirondack Birth to Three Alliance.
I'm getting set up with my notes.
No problem, take your time.
First, I'd really like to thank you for the opportunity, not just to speak, but actually to listen. And that's been a really important part of today. I can do various forms of work in this field, and still, every day I come into it learning more. And I think that's an important part of education as a whole and early childhood, and I want to thank you for the opportunity to listen today. My name is Rose Blanchard. I'm the CCR&R Project Director for the Child Care Coordinating Council of the North Country. I am also an active member of the Adirondack Birth to Three Alliance. When I was asked to speak here today, my very first thought was, how could I possibly endeavor to be the voice for the 191 providers that are serving my region? And my second thought was, how do I do that without forgetting to honor the 59 providers who left recently, myself included? Truthfully, I can't. But I was a provider for over 16 years before taking this current role. I've worked alongside these friends and colleagues even through a pandemic. I've known businesswomen who just entered the field and those who've been established for over 20, 25, even 30 years. No one could be their voices, but I can share some of their stories. The question I get asked the most is, why do our providers leave the field? They leave because they work 60+ hours a week at an hourly rate of less than minimum wage, and their families can't afford more tuition. They leave because they have a wait list and are full for infant care slots, but they don't have enough preschoolers to offset the cost of care for them. They leave because when one slot is open, they lose $8,000 to $13,000 worth of annual revenue. In my area, that's 1/3 of the average salary. And they leave because of inaccessibility, cell phone, internet services, benefits, lengthy travel to reach basic services, goods, and healthcare. The Adirondacks is larger than the entire state of Vermont. Its span is bigger than the 4 next largest national parks combined, but with people scattered all around it. Our population density is a little more than 14 people per square mile, while the state average is approximately 428. Our median household income, it's $10,000 less than the state average, leaving approximately 7,000 of our children, birth to 17 years of age, at or below the federal poverty level. That's 18%, higher than the state average of just over 14. The next question I get asked is, why do our providers enter the field? While many enter because they need childcare themselves, they also enter because of decisions made here, decisions that make way for impactful projects, like newly funded, though short-term, pipeline funds for some of our communities that provide startup grants and full-time CCR&R staff to help them along the way, like childcare assistance being more widely available, like increased market rates that may increase income potential over time, and the infusion of funds for their professional development and careers. The answers I gave you now are real, and they're nowhere near all of them. They're from real providers in my region right now. As of September of last year, our closure rate is 12.6%, a trend that if continued would see that number, the 59 providers who left already, increase to 83. Statewide problems may need statewide movement and support to address them, but they also require a regional approach to be successful. So I leave you with a question that only you can answer. Why will the providers in our region stay?
Thank you. Thank you. No, thank you for that testimony. Extremely impactful. Do you have a breakdown, thinking of the providers who have left, would you be able to share with us any sort of ratio of center-based to?
You know I can, Senator. I'm a joker, so you'll get used to that a little bit. I'm sorry. I like a good infusion of humor. So what I can provide for you, so we conduct an annual State of Child Care report for our region. This only covers Clinton, Essex, and Franklin counties. The Adirondacks actually covers a little bit more, but it doesn't fall very pretty between county lines. So this gives us a little bit more of an easier line to follow. So what I can tell you is over the period of September 1st, 2021 through August 31st of 2022, that and this is a net closure rate. I need to say that before I give this percentage. So this means that this is the difference between what we could recruit and become registered and licensed and what we lost. So this is a net closure rate. Our net closure rate of daycare center and school-age childcare center programs, so these are, commercially located based programs, is 9.2%. While for our region, our FDC and GFDC, that's family daycare and group family daycare closure rate, is 4.82%. You'll notice that our closure of daycare centers and SAC programs is almost double. And that is notable and important to know about our region because some of the anticipated solutions for the child care crisis are very importantly regionally structured. So when you have a region that is so decentralized as my own, it is not uncommon for me to drive an hour and a half to reach one provider to provide my services of technical assistance and support. That means that putting one large daycare center in one place will not serve the areas that are considered deserts in my region. So we're seeing more of a closure rate of larger programs like daycare centers versus family-based programs. I will add too, the reason why that's so important to know is that when one daycare center or SAC program in our region closes, that's 3.62% of all the regulated slots that we have in that county when one closes. Whereas where we have one FDC or GFDC close, that's only 0.2 to 0.4% of all regulated slots in our region. Now, we want no one to close, to be clear, but it's important to note how impactful and different that is for the region that I serve.
Do you see any connection between the population density, it's very spread out in the Adirondacks, and the preferred modality of childcare, center-based versus family or group family?
Yes, absolutely. The stability and sustainability of programs are wildly affected by which modality they choose and the communities they serve. It's also important to know that it is typical for programs to be serving families from counties, neighboring counties, that they don't actually promote and have business in. So families will travel from neighboring counties to providers that are in a different county. And that's an important piece to know as well, because when we talk about all these interacting pieces and all these departments and organizations that providers need to work with, imagine that you are now taking child care assistance from 3 different counties who have 3 different payment schedules and 3 different manners of accumulating and getting that information for reporting structures.
And can you talk more about wait lists that you've seen at these providers and any changes you've seen in the previous few years?
Well, I'll tell you that I don't know that I've ever run a child care program without a wait list. I'll tell you that as a provider myself, prior to leaving the field, I couldn't even keep track of the number of people that I had at that point. I did my best, but the reality was that the infants on my wait list were going to be preschoolers by the time I could take them. And it is a resounding uniform response that wait lists are extremely long, and providers are recognizing that they'll likely never see many of these families.
Thank you.
In your region, and obviously it's different than many of the other regions that we've heard from today, but Mr. Chairman, good job on getting different people from all over the state with similar stories. What other support services exist within your region, like a child care council, to having some of those some of those helps that you can use, or providers and people, or people who are looking for childcare can go to? How's that kind of look up that way?
Sure. Well, it's a complicated question. I will try to address it as briefly as I can while doing it justice. But I want to start with the fact that all of the things that we can coordinate and do to support providers, they are temporary, short-term bandages at best. So we have our local CCR&R, our Child Care Council. We provide a variety of supports that I don't even know if I could list for you, and I do the work.
Yeah,
we have a huge leverage of community support, nonprofit organizations, businesses. We use a variety of local organizations to leverage those resources. So as an example, we may be able to pursue a group rate option if you live within a certain town for healthcare services. So we have these mini networks that we're trying to build for shared services, but that's a very large ask and a very large task. So it's highly individualized. There's no centralized one point. Every provider, we have to assess where are they located, what municipality, what access do they have within their county, within the larger region, what organizations cover their region, because as you can tell from my reports, it's not as simple as county lines or regional lines or Adirondack Park lines. So what they may qualify for with support is highly individualized and takes a lot of time to kind of mull through and create a support system for. But it is something that my organization and the partners that we have do. And
Well,
it's not something that's written into CCR&R contracts, but it is what we do.
Well, thank you. And, whether it's different centers on different blocks or different centers in the Adirondack region, it's all the same thing, the same trying to provide. And the barriers and obstacles are sometimes a little bit different, maybe geography-wise, but all the other things, when it talks to, the finances and what the state resources are, they're the same, essentially. But thank you.
I think that's part of the problem, is that they're all the same.
That's a very good point.
We need to address that. Equal is not necessarily equitable.
Thank you for that.
Rose, thank you for your testimony today, and thank you for making the trip down here from the Adirondacks. Really appreciate it, and we needed to hear it and make sure your part of the state was represented. And I know you had some concerns about representing them. You said in your testimony, but I think you did so very well, and it's very critical to hear that data and that testimony as we work forward towards this.
Thank you again, and thank you to everyone here that's presented. It's been wonderful to sit and receive it.
Thank you. Safe travels. For our final panel from the Mid-Hudson, we have Robert Weichel from Ulster County's Child Care Resource and Referral Agency, Aisha Hart from Columbia County DSS Child Care Assistance Program, and Teresa Lewis from the Columbia Green Child Care Resource and Referral Agency. Little musical chairs, is that right?
I'll go first.
Okay, great.
Can you hear me?
Maybe not quite.
Can you hear me?
There we go.
Okay, there we go. Okay, so my name is Aisha Hart, and I am the program director for Columbia County's Child Care Assistance Program. The child care crisis is very apparent in Columbia County. Our families are struggling to find safe, reliable, and affordable child care for their children. This is even greater for single-parent households. Columbia County, as well as most of New York State, is a child care desert. In our county, we have 30 child care programs in the entire county. Many of these programs have wait lists that range from 1 to 84 people waiting for a child care slot. Some providers in Columbia County have the ability to open additional care rooms to enroll more children, but cannot because they do not have the staff to operate these rooms safely.
Finding staff willing to work at a child care facility is difficult for many child care providers because they cannot afford to pay a livable wage. Once New York State increased the market rates to 80%, I had a provider call me to say she's finally able to give her one additional staff the first raise in 13 years. I don't think any of us in this room would have stayed at a job where we did not get a raise in 13 years. All of our child care providers put the children they serve first and spend a great deal of money on safety and fun learning activities for the children in their care. Providers cannot continue like this. Since working in the Child Care Assistance Program, I've witnessed our child care assistance cases decrease by 75%, most of them since the pandemic in 2020. This is a major issue for the families in our county because 15% of the children living in the county are living in poverty. The Child Care Assistance Program cannot assist families in paying for child care if there isn't any to be found. I see families on a regular basis using community groups on social media asking if there's anyone to watch their child. Many of these parents feel as if they have no choice but to utilize unlicensed care because that's all they have as a resource and the high cost. Most families, even those with good paying jobs, cannot afford the high cost of child care without assistance. The Child Care Assistance Program now serves families who make up to 300% of the state income standard. While this is a very welcomed increase, it is not enough for many families to afford child care and their additional increasing financial responsibilities. This is apparent to me every day. I've had to deny several families who are making above the 300%, who call me and say they don't understand why they are denied when they cannot make ends meet as it is. And they are struggling to provide basic necessities. I've had several calls from providers asking for assistance for the families they provide for. Some of these providers let the families get hundreds and sometimes thousands of dollars behind on their child care bills because they know that the families are doing what they can. And they can't discharge these children from care because they know how terrible that will be for the families. Many working families are struggling with the increased expense of housing, electric, transportation, and food, all of which come before child care. My husband and I are expecting our first child in April of this year. I am on those wait lists that I talked about earlier. As a family of 4, we do not qualify for child care assistance. They say it takes a village. Yes, the people in this room are the village, but we no longer have a local intimate village. Grandparents can no longer care for grandchildren while the parents are working because they are working later in life. My husband and I, along with other families, have to make the tough decision that one of us will stop working full-time. I'm asking New York State to invest in our children by offering a livable wage to child care staff, to increase the income guidelines for child care assistance, and to make the application process easier. Thank you.
I'll go so you can wrap it up. Okay.
It should be on.
It's on. Can you hear me?
Just lean in.
You can hear me?
Yeah, just lean in or bring the mic closer.
Okay. So my name is Teresa Lewis. I am here today representing the Child Care Connections, which is a CCR&R in Columbia, Greene, and I work in part of Ulster County as well. I want to thank you for giving me the time to share my insights today. And I hope that I help you, inform you a little bit about the process and help make a difference in the lives of families in New York State. So as both a professional assisting providers in meeting the child care compliance and a parent of a very energetic 3-year-old boy, I'm here to offer you a more unique perspective on the crisis that child care and families are facing. On a daily basis, my agency receives phone calls for parent referrals that are looking for child care for their children. Or who are calling for a second time because they've already exhausted the first list that we've given them.
giving those numbers, those providers, to those providers is great, but the heartbreaking feeling of knowing that those providers have no openings for those parents is overwhelming on a daily basis. We continue to give phone numbers, and we continue to try to advertise our childcare slots. We continue to try to advertise to get childcare providers, but the reality is the wait lists, as everyone has stated today, are very long. So here are some things that we do know about people who are calling us. Parents, disproportionately women, are not returning to the workforce. Families are having fewer children. Families are attempting to plan their children, their pregnancies, around when a provider may have an opening, which is very difficult. So to give you an idea, currently infant spots in our counties are 52% of our referral requests. And an in-home child care provider can only take 2 children under 2. As Heidi mentioned earlier, that is an infant spot considered, but at a center, we're at 18 months. This is definitely a problem we need to look further into. While daycare providers have the ability to add an assistant to their in-home facilities, a typical daycare provider can't afford the expense of doing so by paying wages, insurances, and any additional needs of hiring someone. The Child Care Connections is a program of Family of Woodstock, who we recently completed a needs assessment for our counties. Again, it's Columbia Green and Ulster. And I'd like to break down the estimated amount of children living in the counties versus the spots available for those. So for registered program spots. In Columbia County, infants, again, under 2, there's estimated 918 children with 79 slots available. For toddlers and preschoolers, which is age 2 to 4, there's an estimated 1,477 children with with 481 available slots. In Greene County, infants, 762, slots available 26. Toddler and preschool, 1,212, slots available 279. In Ulster County, the numbers are astonishing. Infants, 2,550 infants estimated, slots available 281. Toddler and preschool, 4,106, slots available 2,453. If we average those numbers across the counties, this is a 6-to-1 of ratio to children to slots. Put another way, that means for every 6 children in these counties, only 1 is likely to be able to secure adequate care, most of the time at a significant cost to the family. It also puts 5 other families in an increased risk of leaving the workforce to care for their children. As you can see, childcare is in a very serious crisis. Where do these children go? Are they in a safe environment? Are they loved? Are they being nurtured? Are their needs met? What about the children who are working out with parents working outside of regular business hours? Columbia and Greene counties have no providers that provide non-traditional care. They work regular banker's hours, and with Ulster County, there's very few. While childcare has long been in crisis, the impact of COVID has exacerbated it. Although child care providers were considered an essential service, and the majority of our providers remained open to serve their communities, there were still not enough slots to meet the available demand, and that included when we had the waivers to take additional children. Therefore, parents needed to turn to other methods, such as using illegal childcare, so that they may continue work. Once again, that's a huge safety issue, using illegal childcare. While the rates for child care assistance have continued to go up in the last year, inflation is causing rising costs everywhere and still making it a struggle for parents to be able to afford the basic care. Most families are unable to survive on 1 income, but do not qualify for daycare subsidy on 2. I myself am a perfect example of this. In 2018, I enrolled in law school with my hope to become a lawyer. Unfortunately, that was sidetracked when I found out I was pregnant in 2019. Not unfortunately, but unfortunately. As a family, we were unable to pay for childcare while I attended school full-time on 1 income. Thankfully, I was able to continue at an online master's program, and I did graduate from law school in May of 22. But I hope to return for my JD once my son goes to school, and our childcare expenses decrease drastically. This also places me in a group of not being able to continue to expand my family due to the overall cost and expense of childcare. While childcare is unaffordable for many families, it's also unaffordable for our providers. Market rates look great on paper, but very few providers are able to charge the market rate because parents can't afford it. On an average between counties, providers are making approximately $189.25 a week per child. That's $3.78 an hour per child. At a full caseload of 6 children full-time, that's approximately $22 an hour on a 50-hour work week. This doesn't include school-age children. Factor in all their expenses of running a daycare, and what are they actually making? You can imagine the expense of running a daycare center where you're struggling to pay for a living wage yourself as an owner, struggling to pay your staff, many of whom find it difficult to stay in the role themselves if they have younger children. And most places are not discounting children if you work for them anymore, the cost of your child being in that program. Many owners place themselves on the back burner to ensure their staff is taken care of. No owner, provider, or staff member should have to struggle to live. I would like to leave you with this thought. Childcare is not an option. It's a necessity for our families and for our businesses to continue to grow. And as we've noticed, people will start to move where they can reliably find what they need, whether that be out of New York State or not. It's critical we continue the discussion on the dire need throughout New York State, and we work together to find solutions on the growing problem.
Thank you.
Hi, so my name is Robert Weichel. I'm the parent referral specialist for Child Care Connections in Ulster County. So I work with families who are looking to find spots for their children. I also work with our providers who are on the child and adult care food program to make sure they've got good, healthy food and get reimbursed for the food that they do provide to their children. So I'm just going to focus a little bit more on Ulster County. The child care crisis is laid bare in Ulster County. As my colleague said, there's estimated about 8,000 children under 5 years old in the county. As of January 15th of this year, we have a total of 330 available slots. Many of these children may be in pre-K programs, but as we've heard throughout the day, pre-K programs do tend to be a bit of a draw away from our community-based programs, specifically our family and group family programs. Ulster County has seen a total 47% decrease in childcare availability in the last 10 years, illustrating that while the pandemic certainly has exacerbated the problem, it is not new. Providers who run family or group family programs are ineligible for student loan forgiveness because they are considered business owners. I recently did a child care referral for one of our providers so that she can go work a second job at night to cover her cost of living, and she's getting a legally exempt provider to cover her children while she goes to work a second job. The rise of a gig-based economy in Ulster County has created many hardships for working parents. The Child Care Assistance Program creates many hurdles for parents who work non-traditional jobs or hours to qualify for assistance, especially if you don't have an employer but work as an Uber driver, cleaning Airbnbs, things like that, that are becoming the economy in Ulster County. The amount of discretion given to each county creates a situation where I'm telling parents over the phone, it depends on your caseworker. Should never be the case. The lack of programs that provide care on evenings and weekends make it next to impossible for working parents who work in the burgeoning hospitality and service industries to find reliable care. This leads parents to make the hard decision to rely on unlicensed care or lose their jobs. Many of the parents we work with use the other services within our agency to help with housing expenses, utilities, access to food, and transportation. As all of these costs skyrockets, their wages stay stagnant, and the same is true for our providers. There were the stabilization and desert grants that rolled out to help our providers, though the rollout left much to be desired. We have one provider in Kingston who opened as a group family program, meaning that she could take 12 children plus 4 before and after school-age children. As a requirement of receiving the grant funding, she had to hire a full-time staff person. She was unable to do that. She's not receiving the grant money, and she's going down to a family program, cutting her slots in half. In Kingston, our Head Start program has been closed entirely due to staffing, and in Ellenville, there is only one Head Start classroom. We know that continuity of care is incredibly important for children, and we are seeing children who haven't been socialized with their peers. First because of the pandemic, and now because there aren't any openings or the care is cost restrictive for the parents. When they are finally enrolled in care, they lack social skills and are labeled as difficult children. Our providers do not have the time or resources to properly work one-on-one with the child, get them evaluation services, and in worst-case scenarios, the family is asked to leave the program. Curriculums are available, like the Ages and Stages questionnaire, that can help providers identify children and evaluate them, but this is a cost-restrictive curriculum. 40% of families report they cannot find care because there are simply no openings, followed by location. There are very rural parts of Ulster County with absolutely no care, cost, and not available during hours needed. In communities in the Catskills like Phoenicia, Mount Tremper, and Tannersville, whose economies run on tourism, there are no care options for parents who work those jobs to keep that economy going. I myself am a single parent, and until the expansion of the Child Care Assistance Program, we made exactly $600 a year too much to qualify for the Child Care Assistance Program. That $600 come from my son's survivor benefits from the death of his mother. When I work with parents, I frequently find myself saying, I'll be fully honest with you, we don't have any providers who will be able to meet your needs. In these cases, I try to refer them to the legally exempt child care program, but many people don't have anyone in their life that they trust to provide care. We work with many foster parents calling to find childcare slots for their new foster child, and the discouragement I feel and can hear in their voices when they realize there's no childcare for the child they just welcomed into their home. It is currently more expensive to send your child to full-time daycare than it is to send them to the State University of New York. How do we expect our families to thrive, our children to thrive, when the cost of safe and reliable care is so high? The state must invest in our youngest citizens. We must address this crisis and address how tied to our housing and inflation crisis it is, or we will fail our children.
Thank you. Thank you all for your testimony. One thing we haven't really spoken much about today is the notion of childcare deserts. Would any of you be able to define a childcare desert in New York for us?
Define the area, like an area?
Define what it means for an area to be a childcare desert, the ratio.
I don't know exactly what the ratio is.
Hold on, I have that here. I believe, sorry. I believe it's a 4 to 1, 4 children per 1 slot makes it. But I might need to double check that and get back to you on that specific
4 to 1.
ratio.
I've heard 3 to 1, but for a desert. But you know, Miss Lewis, you were talking about a 6 to 1 average, and then some of them the numbers you're running sound like it was almost 10 to 1.
Yeah, so Ulster County would definitely be considered a little higher just because obviously the numbers are a lot more drastic. But across the counties in general, it's a problem.
It is just impossible for anyone to find a slot. Ms. Hart, you're expecting in April. Congratulations.
Thank you.
You're already on a wait list, and you probably have a better sense than many parents of how long it takes to get off. When are you expecting to get off the wait list?
Yes, so we are on a wait list. Right now, it's looking like my child will be over the age of 1 before we get into a child care facility.
So one thing that came up in the governor's state of state was saying that about 10% of parents that qualify for child care actually engage with it, and suggested making the application simpler. And while I agree it can be made simpler, especially by reducing means testing, it sounds like there actually are just not enough slots for parents to actually engage their kids. So in addition to the change to the application, what could we do to help more parents access childcare?
So there is the legally exempt childcare program, which I alluded to. So you have to qualify for the Child Care Assistance Program to qualify for legally exempt. And essentially what that is I would just appoint someone to be a child care provider. I wouldn't have to pay them out of pocket. They would get paid through the Child Care Assistance Program. So a short-term solution would be to continue to expand eligibility for child care assistance so that more folks would be able to use something like the legally exempt program. Within our office, we do have like a kind of an application for what we call an informal childcare, where we offer them all of our battery of trainings and CPR training, and so that we do kind of have maybe a fallback plan if we find somebody who could use the LE program but doesn't know anyone. We at least maybe have a few folks that we know that we've vetted.
And can I add to that? Really important is that we increase the childcare providers that we have. And I know everyone's alluded today to the fact that wage increases are necessary. It's not just wage increases, it's in ensuring that they have insurance, that they have all the benefits that they need to continue to move forward in their lives and their careers, helping them get through school with grant funding or something of the sort where they're not forced to pay for that themselves on something that they really can't afford or take loans out for to afford to pay back. And lastly, startup costs for people who want to invest in daycare, whether it be an in-home daycare or a center-based daycare. There is no funding provided by New York State through OCFS. Most recently, our agency actually started working with Columbia Green Community College and the Columbia Green Workforce and has secured a family child care training program that, of course, once again, income eligible people, the income eligibility is pretty fair, can come and they can run through the course and take all the trainings needed in order to open their own family or group family daycare, because there are no other funding sources. So we as counties, as agencies, as CCR&Rs are starting to extend out as far as we can to try to produce money, funding to help people get started, because it's expensive to get started. Not just training. If you need a fence for the, your backyard, that's thousands of dollars. It's impossible in this economy.
Thank you. So you all three would agree that helping more parents access childcare is not simply a matter of changing the application for childcare, but also deeper funding to increase the number of childcare teachers as well.
Oh, yeah.
Absolutely.
Thank you.
You're welcome.
I see in some of the notes that I have that in the 2022-2023 enacted budget, there was $50 million for a child care capital program. It says it's not up and running yet, but it is, for what you were just talking about, if you were going to either expand or construct new, design, rehabilitation, improvement, furnishing, or equipping a new or existing child care facility. Because one of the things that you said, and I wanted to ask you before I even got to that, was talked about, and we've heard it mentioned a few times, illegal daycares, right? And again, we were talking earlier today about the tragedy in Queens and an illegal child care facility, along with a dentist's office, I guess, in the basement of somebody's house. 18 children, I think, were there.
Oh my gosh.
What do you see in your region, Columbia, Greene, Ulster County, on illegal daycare centers? I'm just curious, because we really haven't asked that question.
Sure.
I don't know if you really, I probably can't give a firm answer, but is there a lot?
Yes.
Okay.
Yes.
So I am sure, I'd like to think, and you would know this best, that many of these people that are doing these illegal daycare centers are doing it not for the money per se. Well, I guess they are, but they're not making a whole heck of a lot, unless they're gouging people because they're the only place in town. But out of the ones that are operating, what about if there was a program? Instead of being punitive, the state and local agencies would be able to say, okay, let's create a real one here. Let's create one with all of the things that you need to do, from the facility to the training to the insurance. I think you spoke about that also, making sure. That sound worthwhile?
That's exactly basically what the Family Child Care Training Program is aiming to do, is to hopefully reel in some of those illegal providers. As Asia said, on a daily basis, you can go online to any of our community boards and you can see parents begging for someone to watch their child. The worst part is that they don't know these people responding. So they're putting their child in care the next day with these people they don't know. So I think that there needs to be deeper investment than just the CCR. And the CCR&Rs are really fighting to make this happen, but we really need the state to back us on that too.
So that would be a regulatory thing, also a financial thing, but really, to me, again, you know, if you've got those places, you know, not every single one of them, you know, should not be.
Absolutely
Given the
not.
right set of circumstances and regulations and standards, right?
So currently, the way OCFS operates, that if there is like an unlicensed program, there has to be a break in, like, they can't just go right from running it unlicensed into becoming licensed. They have to say that they stopped doing it wrong, which, like, maybe that's a regulation that could be re-examined.
Right, because obviously, with the right person or persons, and they were not creating a real risk for their clients, if you had them stop, where are those kids then go?
Exactly.
And then you throw the family unit into chaos because outside of the fact it wasn't licensed, it was providing a service that you needed to get to work, go to school, or whatever it was that you need to do. Probably all three of those things, right? And healthcare. So, but that's something we, you know, we could talk about too. I know, you know, a lot of these things, and this isn't just, you know, typical state government, it's just many regulatory bodies. A lot of those things like, nope, gotta stop. Can't keep doing this. Not looking at what the real ramifications are for whatever stops, whether it's a business, a regular type of business.
I think that's, and a lot of people spoke about kind of like being overregulated, and I don't mean this in a sense of being overregulated, but sometimes the regulations are very firm, where sometimes they kind of leave a lot of wiggle room, if you know what I'm saying. But this is one of those things that's very firm. You have to come into compliance if you're illegal in order to get registered. And I do think that that would be a very good change, because now we're helping people get registered. It's something we can train them on. They are inspected regularly. So the safety of the children is really what we're looking at. But unfortunately, a lot of people stop. You go out, you can monitor them multiple times. They can go right back to doing it until they're reported again, right? So we don't have the ability to go and seek out all these illegal providers. It's a reporting thing. They have to be reported.
Right, you don't know about it until you know about it.
Right.
Thank you all.
Thank you so
Thank
much.
you.
Thank you all.
Thank you
so
very, very much.
Well, I just want to thank everyone that has testified today or was listening. Again, the people that helped put this together and the New York State Senate. This concludes our hearing for the day. Thank you.
Thank you all.